Well, oh, well, yes, yes, hello. Yo, what is up? Welcome, 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 welcome in. Oh, Marissa, you're right on time. You are right on time, my friend. Welcome, welcome, welcome. What a time to be alive. Yo. How much you paying? I don't know. We'll have to see. We'll see. Good evening. Hello. Welcome, everyone. I don't know. We're just starting. We're probably gonna talk about the increase and decrease in measles rates. Gonna talk about science, politics, the world in between. Oh, Robert Redford passed away. Oh, dang. Hi, Amadizi. How's it going? Good. What's up, everybody? Thank you. It's a really good toupee. I agree. Thank you. Welcome, welcome. Las Vegas. I love Vegas. Beautiful. Thank you for following. Beautiful. All right, guys. Well, what's up, Cheryl? There you are. Thank you for coming. Thanks for being here. All right, guys. So we figured out what's happening. Yo, Elia McBride. Thank you, Elia. Guess what? Well, guess what, guys? Elia just... Hey, Uguay, how's it going? Guys, you know what time it is. Elia McBride wakes up. The vaccine boy. Isn't that cool? I love when this happens. Hi, TCR. How's it going? Good evening. Good night. Good morning. I'm sorry. Let's see, guys. Let's wake it up. Ready? In 3, 2, 1. Dude, vaccines save $11 for every $1 spent. Isn't that incredible? What an incredible way. The thoughts on the press briefing. Which press briefing? With the FBI guy? You're in the top 1 percentile of Neanderthal DNA. Congratulations. That's cool. So Elia has 2 vaccines, guys. That's what we're waking up the board for. Right? You got 2, right? I got my booster and flu. That's 2. That's 2. I like to see it. All right, guys, like we're going up to 173. In 3, 2, 1. Yes. Elia McBride, thank you so much. Thank you for being here. We love people who vaccinate in this community. Every single shot, every single time, we love and appreciate people who get vaccinated. And it gets me all fired up. I get all, this isn't actually an effect. I just get this jazzed about people taking public health seriously, and I appreciate you. So thank you. Thank you. Did you hear about the girl from thousands of years ago that was mixed with different human species? I mean, we all are sponge. I guess we all are, right? We're all. You don't have to spam it. It's all good, bro. It's I mean, we're all Denisovan and Neanderthal and Homo sapiens, and we are all hybrid. I've tried and they won't give me the vaccine. Cher, is that from you need to have a doctor's prescription because of your state or a pre-existing condition? I know, Slessy, isn't it? I know. Well, we're not technically monkeys. We are primates, though. But I understand what you mean. Homo habilis? Neanderthal human hybrid. Okay, interbreeding between archaic and modern humans. What a cool Wikipedia article. Interbreeding between archaic and modern humans occurred during the Middle Paleolithic and Upper Paleolithic. The interbreeding happened in several independent events that included Neanderthals and Denisovans, as well as several unidentified hominins. In Europe, Asia, and North Africa, interbreeding between archaic humans and modern humans took place several times. The introgression events between modern humans are established to have happened between 47,000 and 65,000 years ago with Neanderthals and about 44,000 years with Denisovans. Pretty good. Pretty cool. Pretty cool. I think probably Neanderthal and Denisovan in it. Ducray, is that a novel that you're writing? I mean, gross. It was the Denisovans and Neanderthals in the cave. I know. Jeez, Ducray. God. No, Denisova is the cave. That is the place of the cave, and that's why we call it that. I joke. It's true. Yeah, it's true. I can vaccinate at will without a needle. That's impressive. That's pretty cool. All right, Uguay, have a good one. Hello, how's it going?
Good. Yeah, I was looking at your conclusions about the COVID SARS-CoV-2 originations, and
yeah, the SARS-CoV-2, yeah, the
yeah.
2025.
I think.
Chris Christoph. Sorry.
What? Sorry, can you say that one more time?
It's Chris Christoph 2025. Is that what you're talking about? The paper that I have pinned to my profile? Is that what you're talking about?
It's that's one paper, but I think a lot of papers reference it as well.
Yeah. That's the
Talking
latest
about
one.
it, but it is. Well, I'm a little skeptical about it.
Okay.
Well, I mean, totally tin hat foil, but not really tin hat foil. But it's really like I really think the what do you call them? The CCP covered a lot of it up. They,
Okay.
if I recall correctly, they like cleaned out the whole market. They cleaned out the whole Wuhan laboratory. They barred international scientists from coming in and gathering their own. Yeah, it was for months they were banned. They didn't go in.
No. So they did allow the WHO in. That's where those samples are from the drains. But you're right in the fact that they cleaned out the animal specimens. Like they didn't have the live animals there anymore. I mean, and can you blame them if it's the actual spot of a zoonotic transfer event? I mean, you kind of have to clean out the animal remains and
they
animals
shut
themselves.
Down. They sterilized the whole place.
No, they didn't, because you can get the samples. They got the samples. WHO went in and got the sampling.
No,
I
don't think the WHO went in. I think the CDC provided the evidence.
No, the WHO
or
did.
The CCP provided the evidence.
Who
did come in because
they didn't.
Because
the
I'm pretty
WHO
sure
went in and they got it. That's what they.
Do you know what day they came in?
And they got the blood samples. That's because they did the serology tests for the Wuhan Institute of Virology workers. So they did collect that data.
Yeah. Do you know what day they came in? Because they were barred from coming in for a while when it was first outbreak. So
I mean, that's where all how did they get it? How did they get the DNA and RNA sampling data then?
I mean, it could come from anywhere.
No,
Like
no,
they could have grabbed it from anywhere. I mean,
no,
if it's
no.
what do you mean? I mean, you just completely trust it wasn't just look it up yourself. The CC, I'm pretty sure the
They
CCP provided the evidence to WHO, not the WHO gathering the evidence from the specific locations. So I think there's a little too many chefs in the kitchens right there.
mm,
So I don't
no.
I
I mean, you're the
yeah,
first person that I've heard say that they did have their own data that they had that they didn't necessarily release, and that did accidentally get released on one of the a server that they had. So you're right, and that happened. Like, but that data correlated perfectly with the ones that WHO had. So
yeah.
again, like it's just
My claim is the WHO didn't collect the evidence. This it was provided by the CCP. Um, I also, if I recalled correctly, the WHO and other international scientists wasn't allowed access into Wuhan when the outbreak was going. But also just think about it. It's like if it was like a natural outbreak, then the international scientists wouldn't have been barred. They would like try to get to the bottom of it. Um, but I think there's just like taking it from the CCP standpoint. Let's just say it is a cover up. Well, from for their standpoint, they have a lot of reasons to uh, make that claim because it will be quite an embarrassment, and also like the field of virology will be taking a huge blow when it comes to dual use technologies. So, but like I think that paper doesn't. While it shows evidence that it could be a zoonotic spill, like I'm still skeptic about it. But
okay.
is
So you haven't
um
provided any positive evidence for your claim, just to be
no,
clear.
no, well, what I think the case will be closed when the host or the reservoir species is discovered, if it ever gets
It
discovered.
already is. It's already done.
No, it's not.
Yes, it has. Again, you don't
The bat
understand what you're talking about, and
the
you're
bat
trying
the
to say
bat the
no.
bat they highly suspect it's from bats, but we haven't found the reservoir species. The closest thing they sequence is what like rat 4G
No,
13 or
rat
something
sheet
like that.
13. No, again, you're misinterpreting things, and you're not understanding it. It's
Oh,
okay. You can ask questions. Just don't
yeah,
say things with positive if you don't understand what you're talking about. That's fine, but like don't make
well,
claims
I'm
that
putting
there's a
it's not
global conspiracy when you don't
it's
understand what
not
it is. That's
conclusive.
no,
Like I haven't found any.
just ask the question, and I will tell you what it is. So you're talking about that we haven't found SARS-CoV-2 in nature. Okay, which is fine, and that doesn't mean that there couldn't have been a viral genome recombination event at the wet market, and that's what likely happened. But what you're saying is completely false. That we have the reservoir species because we can do molecular forensics, and we found that because of RNA viruses, they change their mutation rates differently based on their environment, and their environment is going to be inside the reservoir species. So they have a molecular forensic thumbprint that we can basically figure out. So they found out this was SARS-1. The reservoir species was in a camel, and the bats were the reservoir species here. They have all the bats are all being surveilled. We know that the thumbprints of the different parts of the SARS-CoV-2 genome has been found, and we that all the parts are there and recombined at the
Yeah, I'll
Wuhan
100%
market.
agree with you if we did identify the reservoir species. But
Yeah,
like from what I read, it's just only highly probable. They haven't confirmed it. Like
like I
I
said,
can look at the
they
Google.
haven't found SARS-CoV-2 inside the the rat G13 is the last common ancestor that they have, think, and it's like 99% like of related, and it's so
I don't.
it's
From
10,
what
but
I
it's like
read,
10 years ago. It's like 10 years ago.
from what I read, like I thought the scientific community concluded that the rat 4G13, whatever it's called, wasn't a progenitor of the virus of
Correct. Yeah, it's not
SARS-CoV-2.
from, but it's the last common ancestor kind of thing. The last like closest related ancestor in the
It's the
tree.
closest related, which
Yeah.
is like it's like 96% related. or 99.6.
Okay. Yeah, something like that.
So
I don't remember.
I think it is 96, which is quite far. But it's, I mean, the one thing I get really this, besides the Wuhan virology lab, I mean, that might just be a coincidence there, but
It's not a
like
coincidence.
from
They know from SARS one that it was going to be a likely spillover event in this area of the world, and they put it there specifically.
um I mean, I just it could, when I say it's coincidence, but why would, I mean, the Virology Institute can be located anywhere in the world.
Yeah.
Like maybe logistically, it might be easier to transfer the samples to that city, but but like it's you could have, you could put it in different outside of China and have a virus researched on.
We are
Um,
coordinating with China in order to have a better relationship with them, and that was a centrally located location based off of SARS one, based off of all the virology that was done, and that's where it was done. That's where
Yeah,
it was
but
put.
as far as like zoonotic spillover events, like, is there any other zoonotic spillover events where the virus was contagious and virulent at the same time?
Spillover event. I mean, what do you mean?
That
I mean,
like
it didn't.
usually when zoonotic spillover events happen, the first cases, they're highly deadly, you know, um, and then when the outbreak happens, is because the virus becomes a little less virulent, doesn't kill the host, and evolves to become contagious. You know, when I was like learning about this, you know, when the outbreak was coming out and the deadly effects of that, I was like, all right, my plan um, was to wait it out and eventually hope it like evolve into a less virulent strains, which it did. But yeah, this is the first zoonotic spillover event where it's both contagious and highly virulent at the same time, which makes me, you know, which is, if it was zoonotic, it would be the first that I've ever known, right? If it does, if it was engineered to have to affect human hosts, then like a lab spillover could make sense there. So that's like the only thing that like
No, there's not.
makes me
No,
think like,
you're again like none of the virology workers had any antibodies in their system. They would have had to have tons of. You're not putting all the pieces together, like like the in order for the lab leak to have happened, one of the lab workers would have had been exposed and would have to have a large amount of viral load, enough so that they can actually go from the Institute of Virology to the seafood market, the wet market, which is far. I think it's really far, and it's not somewhere that you would normally go. It's not a
yeah, I mean
highly
like,
trafficked position of a spot. So the so the fact that they would go there and then they didn't have any antibodies in their blood, and then they go in the wet market and then they cough and sneeze on everything, on all these different animals and all these sewer drains and all that kind of stuff without having any antibodies, and then also not spilling over when they made that trip. Okay, they didn't infect anyone from there, which is insane. And then they would have had to have done the same thing and had the exact same spillover event and leak event at the second time a week later, and did the exact same thing without any. It's just, it doesn't make any sense, man.
uh, I I mean that's, I mean like I said, that's
That's what
if
the
you accept,
independent data.
if
No, that's
if
what
you
the
accept
actual
the data,
data. That's what the data
yeah.
says, and that's what it is. I mean, that's what it.
I mean like it is. I mean like the Chinese, people, they could be. Do you know if the Wuhan virology lab worked with live animals?
I don't know if they do or not. I
I
don't
don't
know.
know. Well, Ben, let me just ask you the question. Like back then, like have you known of any zoonotic spillover event that that where the first infected cases were virulent and then became contagious, or
I mean, I'm
or
not a
rather,
virologist. I haven't studied outbreaks and zoonotic spread events in order to make a positive claim on that.
yeah. Well, okay. You're what, molecular biology?
Yeah, I've been doing molecular biology for 16 years. I have a microbiology PhD.
Okay, okay.
But I can't.
Yeah.
I mean, I'm not a virologist. I mean, I'm connected, but I'm not. I'm not.
Yeah.
I mean, I actually I drew this up like in order for. It truly is like it's wild, dude. I mean, you have like all the independent data that we have. I posted it in
Mhm.
the Discord, guys. The oh nice limoncello. Okay, we'll do that. 1 second. Limoncello. So you have high viral load, no symptoms, only one lineage of the virus. Okay, only one lineage at the first week. Never seeks medical care. Right? They don't go to any place because they don't go to the hospitals. And somehow they have a huge, large viral load, but no antibodies are created. They travel 20 miles directly, no other contact with no other humans because it didn't go anywhere else. They go to the Huanan seafood market, which is a low traffic area. So it's not like, oh, this is the central Times Square where everyone's going to go. They go specifically to a seafood market, and then they spit and cough onto raccoon dogs, Siberian weasels, all these other people. And then 1 week later, a separate genetically divergent strain does the exact same thing. So a second virus leaker now who is trained, has an equipment failure, has high viral load, no symptoms, only the lineage A, right this time, a completely genetically distinct sequence, goes, never seeks medical care, has the same thing, incredibly high viral load, no antibodies created, travels 20 miles, doesn't contact anyone else, goes to a low contact, low traffic Huanan seafood market. Then that person also spits and coughs onto raccoon dogs and weasels. That all would have had to happen. Okay, the two, or you just have someone brings in their weasels, their Siberian weasels and their raccoon dogs from
Uh-huh.
their home farm, and you just have that happen 1 week after the other. Like, I mean, it's so it's two steps for the natural origins versus, and all the evidence shows that, and it's linked to all the other pandemics, or that first case had to have happened like 30 different Rube Goldberg machine like things that would have had to happen. And these are all independent, like verified things. It's not just one chain of event. I mean, do we know 100%? Do we know 100%? No, obviously we don't. In science, we never know 100%. But like, how are all these other things corroborated then?
Yeah. Well, I think I joined your Discord. Maybe I'll provide you some
There's
uh,
no positive evidence.
documentation
There's no
on.
positive evidence. There's
No,
none.
just on some of the claims I made on on the international issue being barred from going to
I did
run.
see that I did see that I think you are right there. They did talk about the how these samples were made and collected. So you are right in that the market was closed the morning of January 1st, 2020, shortly after the identification of the pneumonia of unknown etiology. On the same day in the early morning, the Chinese Center for Disease Control and Prevention, the China CDC, dispatched an epidemiological team together with experts from the Hubei provincial CDC and the Huanan municipal CDC to the seafood market to collect environmental study samples and the potential introduction of SARS-CoV-2 into the market. From January 1st until March 2nd, a total of 923 environmental samples from different locations within and around the market and 457 animal samples, including dead animals in refrigerators and freezers and stray animals and their feces, were collected, with some stray animals sampled until March 30th. After the closure of the market, the outside surface of the rolling shuttered doors and the stalls and the corridors were disinfected with bleach throughout January and February 2020. The goods inside the stalls were completely cleared and disinfected until March 2020. Out of the 923 environmental samples collected in and around the seafood market, 74 were found by quantitative PCR and high throughput sequencing to be positive of SARS-CoV-2 with a positivity rate of 8%. So there's a lot of virus there, dude. The CT value for the qPCR data was 23 to 41. So 23 is super low, man. That's a really high
What
amount
is
of
what is the what'd you say? The
the real time qPCR. That's the RT qPCR. The cycle threshold is 23. That's it's very high.
Can you tell me like layman's term what that means or what that test is?
So basically, it binds. You design primers that are specific to a portion of the genome, and on basically, the CT values are how many cycles it needs to do in order to amplify it exponentially. So, like a CT of 1 is that it needs to go through 1 doubling in order to go past the threshold and to actually visualize it through the probe. So 23 is like it's that correlates with the 8% that you're seeing at the positivity rate. I guess was what I'm saying. That like it's high. It's
Okay.
um
Well, when it means high, what does that indicate?
that there was a lot of viral sample there. The viral load was very high for whoever had the thing was very high. So the idea that
You mean like the concentration of the virus?
yeah, the amount of
Okay.
DNA, the specificity, like it needed to be like there was a lot of template there. There was a lot of DNA that matched the primer specifically, basically, and so
So, so you're so so do you think like whether or not so you're saying that it might not be a possibility that a reservoir species found it might have just been like getting recombinated in the wet seafood market there.
okay, yeah. This is the okay. I think I understand what you're talking about. Okay, so the reservoir is different than the intermediary species. So so it goes from we know through molecular forensic and the RNA mutation rate, it's very very distinct. We know that that was bat coronaviruses, and we also have the genetic sequencing that also of those pools. So we know it was in bats for a really long time. And then there was an intermediary species, so the bats they get disturbed, they get because of urbanization in China, these bat caves are getting disturbed a lot. And so maybe they infect a wild raccoon dog or something like that, and then someone has a farm in their house of raccoon dogs, and then the raccoon dog gets infected, and then those two different coronaviruses would have to infect the same animal, the intermediary. So the raccoon dog wouldn't necessarily they wouldn't get sick. They're not patient zero. The coronaviruses also, by the way, jump hosts all the time. So raccoon's not a raccoon and not a dog. So that look it up. It's actually kind of wild.
Yeah.
But the so coronaviruses jumps hosts all the time. So the fact that it's going from a bat to a raccoon dog to a human, it's actually not that crazy. It happens all the time. And so basically, even the raccoon dog, when you have the infection event, that wouldn't be patient zero. Even the next person that gets infected from the raccoon dog, I don't even think that they're considered patient zero. It's actually the person that person infects is considered patient zero. So it's like that's that. So and having two. The other question is like, is it that crazy to actually see two separate zoonotic transfer events at the same market, right? Because then the question is like, wait, so there's two divergent species, so that means that like there was one strain that outbroke and then another strain the other week. So there's two separate zoonotic spillover events at the same time within a week, and that has been shown to happen before. So it happens a lot, and we have virology samples and that happened in the United States, for example, where we'll have two separate spillover events because, guys, populations evolve, not individuals. This is like a huge key part of evolution is that populations evolve together. It's not individual viral samples evolving. So it's populations that are recombining, and that's a key aspect of evolution. So it happens. It happens.
Okay, so basically, if we were to assume a zoonotic spillover event happened in the Wuhan seafood market,
Mm-hmm.
it was due to, I guess, bad luck in the recombination there with that virus circulating around the seafood market.
Yeah,
And since all the live samples, I don't think, from what I read, there weren't any testing of live animals. I think they were
they're
all
dead.
cold. Yeah,
Yeah,
they're all cold before everything, and therefore it was just you. So there might not be actually like a, I guess, SARS-CoV-2 running around natively in a group of animals
exactly,
population.
exactly, and that's why we don't find SARS-CoV-2 in the bat population in the reservoir, right? Give you bonus to some empirical data sources. So in my profile, one of the links is going over the latest in the paper talking about this. It's basically like a dozen other papers that all kind of like come together, and that's the latest one. I linked in the Discord in general, talking about basically how we found these samples. This is Liu et al. 2024 from April 2023, surveillance of SARS-CoV-2 at the Huanan seafood market. This goes into the nitty-gritty that I hadn't read before, so I appreciate you asking this question. So you can actually see viral virus actually isolated from the environmental samples at the Huanan seafood market, since there was someone in chat that said that viruses aren't real. They've never been isolated. There's literally pictures, electron micrographs of SARS-CoV-2 viruses isolated from the samples. So I'm surely they'll change their mind and they'll believe viruses are real. But it is
Who says
true.
viruses aren't real?
Hmm?
Who says viruses aren't real?
I mean, my friend, it's yeah. A lot of the anti-vaxxers don't think that viruses are real. That's how they cope with like not taking vaccines, because if you don't believe that viruses are real, then vaccines are only bad, right? Because they can only have negative side effects.
But
Yeah, it's bad.
what,
It's bad, bro. I'm
like
telling you.
how do you like,
I know.
or
It's
how do people like what?
yeah.
What
The
evidence do they
miasma,
have
and
to?
so miasma they explain it by miasma
What's
and
miasma?
so miasma is like the bad air. It's the thing, literally the thing that like
From medieval times?
Pasteur, yeah, from like the 1700s. Yeah, they believe in that stuff. That Pasteur like discredited in the 1700s. So it's
Yeah. Oh well.
it's bad, dude. It's
Uh,
bad.
they just think it's uh, they just think you just get sick from bad air, and
Hmm.
why
Yeah,
can't they just assume the virus is in bad air?
they think that
Or
viruses are they agree that viruses like in microscopy will be they have to agree that something is there, but they think that it's basically from the terrain. They don't think that it's actually the that's linked to any type of disease. They don't believe in Koch's postulates. They don't believe those are
you don't
real.
believe in like STDs or anything like that?
It's a wild world out there, my friend. So
I mean, there are flat earthers, but
yeah, they are.
but
A lot of them
that's
are. Yeah.
I see. There's like a little vaccine ticker there, or
Yeah.
what's that all about?
Yeah, these are all vaccines that we've gotten from our in the community. So like people
Like
that get
any vaccine?
vaccinated. Yeah, any vaccine that you get, you can come up here and we add it to the vaccine total. So it's all
Oh, that's cool.
yeah,
Do you recommend that people take their boosters
for
for?
sure. Yeah, flu and COVID. Yeah, absolutely. It's good to protect against long COVID.
Well, I think I read recently the CDC doesn't recommend it for healthy people.
Yeah, that's just nonsense. That it helps because long COVID's a neurodegenerative disease that can long COVID can impact your vision, height. I mean, not height, vision, smell, taste. It can cause vertigo. It can trigger chronic fatigue syndromes, and it's actually triggered within about like 10 to 20% of people with COVID symptoms. So it's good to have.
Uh, that's interesting. I mean, like what? I mean, I assume during the pandemic you followed the CDC recommendations, but how come not
Some of
this
them,
one?
yeah. I mean, it's very frustrating. I mean, during the pandemic, it was very frustrating seeing. You could pretty easily tell that they were getting hem-hawed around by the Trump administration. I mean, there are several times that the CDC didn't even follow their own guidelines, and it's because the Trump administration through the DHS overrode the CDC. and it caused like a lot of deaths. It was actually a Lancet retrospective that went over it, and it was about 300,000 deaths attributed just to Trump's mismanagement directly of it.
Can you
So
give me an example of what?
yeah, so basically do you remember the cruise ship that was off the coast of California that Trump said that they didn't care about, and they just let them go there for like a week, and then they, instead of the CDC, they had plans of actually letting them in by
Oh yeah.
quarantine, and then making
Mhm.
sure that they were SARS-CoV negative, and then letting them out. But
And is that what Japan did? I remember the cruise ship was like one of the first infected cruise ships, and then it was like off of Japan. I don't really recall the one off of California.
yeah, they let them
I
off
think
right in Southern California. So it was like right into a really busy like port. They just let them out, no problem. Didn't the DHS
no
came in with
quarantine.
no PPE whatsoever. It's just absolutely wild.
Oh wow! So they didn't quarantine the ship, like the
Correct.
occupants in the ship.
Not at all.
They
Yeah.
just let them out.
hmm Yeah, stuff like that.
That's
And then also they didn't actually test or quarantine anyone that was coming in when Europe was closing down. We can actually genetic through epidemiology, we can trace where a lot of our SARS-CoV-2 came from, and it came from a lot of like the Europeans that were vacationing over there, and they weren't quarantined or tested for SARS-CoV-2. So it's just CDC guidelines that they themselves didn't even follow because of the DHS and Trump, unfortunately. So
so. Do you think the CDC guidelines for not recommending boosters to healthy individuals is due your skepticism is correct me if I'm wrong, is it due to perhaps like Trump influence?
currently, it's because of RFK. That I think for 100% sure. Yeah,
Are currently because of RFK?
yeah. And RFK is anti-vax, and yeah,
I mean like I don't think RFK is anti-vax,
he is.
but
He is.
because when I think of anti-vax, it's like no vaccines, right? Or unless you define it a different way.
Yeah, he doesn't agree with vaccines. He thinks that, I mean, he thinks he's like for safe vaccines, but there is no vaccine that he currently thinks are safe. So
Yeah, I think his argument is just that he wants um, he wants testing to prove that they're safe for
yeah, and there
some.
there has been there are tons of them. It's just nothing. He has an artificially high level um of testing that's impossible for anything to meet. So he has them all, and the ones that he right he as the HHS head, he could commission all these studies, right? He could commission all of these studies to test out the safety of the vaccines, or if he knows that they're damaging and they're dangerous, he could pull all of them, but he
Yeah,
doesn't.
I mean,
So because he
what?
knows that he's lying, and he knows that they are safe. So it's
Well, why he's not commissioning those studies, or he's just are you saying that he's
correct.
trying to pull them?
He's not he's pulling like the recommendations, but if you thought it was a poison, then of course that he would pull them, right? He wouldn't allow like poison to be sold.
Um, no, I mean, I mean, I don't think he wants to pool vaccines.
He does. I mean, it's like Samoa, American Samoa, he went over there and was linked directly to like a measles outbreak over there. Like vaccine rates went from like 90 something down to the 70s, which doesn't have link them to herd immunity anymore. And then there was a measles outbreak that was linked directly to that event, and people died, kids died because of that. And then they had to lock down the entire all the schools and the city, and it was awful. So he is. I mean, the anti-vaxxers. By the way, the anti-vaxxers disagree with you. Like they
I think,
themselves, they see him as their champion. So
yeah, I think, I mean, that he could definitely attribute to maybe the increase in outbreaks of measles. But I remember looking at the measles data points, like there's like timeline over decades, and
mhm.
it's really funny that the measles outbreaks happens like every 4 to 5 years.
Mhm.
That like a measles outbreak happens, and I think that's just because like we lose herd immunity and people get freaked out and then start getting measles vaccines, and then and it just kind of rinse and repeat itself.
I mean, it was only at 24%, 74% in 2024. It was already down. You know, it was already down. So it's not good. We need 95% for you need 95% in order for vaccine herd immunity for measles.
Yeah, but like with all viruses, like usually when you contract them, um, then that also gives you immunity as well, right? I mean, that's probably like considering as long as there's no long-term damage or death.
When there's that's what herd immunity is. So like basically no vaccine is gonna prevent you from having virus on your nose or having it get past your there's like a physical immune system that you have. So that's like your mucosal membranes, your hair, all that kind of stuff, the bacteria and viruses that live on your skin. But then there's the trained immune system that you have, which is the antibodies. And basically your vaccine's not going to prevent stuff from landing on you. If it's a good enough sequence to your antibodies that you already have, then it's going to keep your viral load low enough so that it can't transmit, right? That's what the sterilization aspect of a vaccine is. But the problem is when you have a pandemic, pandemic is the global spread and recombination of virus genomes, right? So basically the viruses are evolving past what your antibodies can do. So and your body, by the way, did evolve their immune system in the world of viruses that do have mutations, that are occurring mutations, right? So a single mutation in the viral genome isn't going to inebriate your entire antibody stock. What happens is this thing called somatic hypermutation, where your body actually has antibodies trained for different types of mutations that they might see within the virus. But again, the problem is that you are in a pandemic and viral recombination, genome recombination is happening at a greater rate than you would normally see. So in a pandemic, it's easier for the virus to evade and evolve outside of the somatic hypermutation. So that's why you have a protection of large viral loads with a SARS-CoV-2 vaccine, right? During the pandemic, you were 10 times less likely to die of COVID if you were vaccinated. So, it did have that impact, and you would actually spread it less often. So you would have less viral load in your system, so you'd spread less viral load to other people. So it does have a big impact. And now it actually decreases your rate of long COVID. So it still has a huge benefit. The COVID vaccine still has a huge benefit.
Yeah, but it's like when I usually think of vaccines, like when it comes to like polio, or pretty much all the except for flu shot, because that evolves very quickly every season. When you think of vaccines for polio, smallpox, we most eradicated. Yeah. Those vaccines gave you immunity from the virus if you do get contacted with it. But as far as
because the viruses because there's a low amount of viral genomes in the world. That's why. Because the vaccine exactly matches what your body is viewing. Because there's such a small amount of viral genomes all throughout the world that they don't have the mutations to recombine in order to evade your immune system. That is the point, and that is literally what herd immunity is. That's the physical manifestation of what actually happens.
But with I don't know if it's like flu, but as far as SARS-CoV-2, it seems like it's going to be hopefully just comes down to cold-like symptoms as it kind of evolves its way. But it doesn't sound like the mRNA vaccines you're describing. It only sounds like it only protects you from the extreme tail risks of.
So it's not the mRNA vaccines itself. I mean, the mRNA technology is incredible. already used
Yeah, I agree with
for
you.
gene therapy for cancers and all that kind of stuff. So
Mhm.
you're gonna see that. And if you have cancer right now and you have gene therapy treatments, it's going to be mRNA with
Did you?
lipid nanoparticles for sure. It's good. I mean, the other countries are developing it and spending money into it. It is a really good thing. But it's the fact that SARS-CoV-2 is out there and recombining with lots of other copies of it throughout the world. That's the whole
Mhm.
point.
So it's pretty much gonna be like the flu vaccine, which is
Yeah.
you think the boosters is just the same thing as flu vaccines.
Yeah, probably like you're gonna like every year probably gonna have it. I mean, last year SARS-CoV-2 killed like 47,000 people, but this year it's lower. It's like 12,000. So I mean, hopefully it goes down. We're getting better at treating COVID. So COVID is not killing as many people, but it's kind of like HIV and AIDS. Everyone that has HIV doesn't develop AIDS anymore. Kind of the same way.
Mhm.
So SARS-CoV-2 is a viral infection, and COVID is the disease that's caused by it. So um, it's sad. That's why you need to get your booster. That's why people should get their COVID boosters every year. It's really safe and effective. The vaccine's a good match. There's Yeah, you should do it.
Yeah. Well, last question before I head out and let you talk to somebody else. But
Sure.
what are your thoughts around like, especially when it came, even during the height of the pandemic, but probably even still now, like treatments like, of course, like ivermectin
Yeah.
and stuff. That's, I think there's, I mean, there's research done on it now, but like
It's
during that time,
None
it
of it
was,
was proved to be effective. Ivermectin was shown to be effective at not helping
with
COVID
vitamin.
symptoms at
Yeah.
all. Like there's been several systemic meta-analyses, lots of papers like looking at it, and ivermectin was not shown to be effective at all. So it's just there's Paxlovid and stuff like that, which is an antiviral specifically for SARS-CoV-2. That makes sense, but an anti-parasitic, that people were eating.
It's also antiviral as well.
Sure, but I mean, it wasn't
Ivermectin.
shown to be effective. I mean, ivermectin literally, people, it actually caused more damage because people were eating so much horse paste that they were actually winding up in hospitals. So people
I
actually
mean,
did.
like you can overdose on anything, but it's one of the safest like medicines out there. It's like
Okay,
Nobel
I
Peace
mean,
Prize winning.
it didn't help people with COVID. I mean, none of the
Uh,
papers show it. None of the systemic reviews. None of
I
them.
think there are papers that show it. I
No,
mean,
no, there
but
aren't.
I think there's a lot of evidence against it just because um, there's not money to be made on ivermectin. The
No,
patent was
no.
released.
Merck
Um,
itself, Merck, the company that literally makes ivermectin, had to have warning signs put up and said, "Do not use this for COVID. It's not effective." So that is literally the company that would have made the money on it, and they didn't. A systemic review for the antiviral effects of COVID-19. Let's see. Here we go.
I mean, I think you should definitely talk to your doctor before making any medical decisions. But I'm a little more skeptical about um, there's a lot of if there was an alternative treatment that was safe, effective, and cheap, that's not good for big pharma. I mean, that might be oversimplifications, but I think
No,
there's
there's
you
no,
know you
there's
got
no,
you gotta
there's
like
again,
look at
there's
that
gonna be
lens.
no, there's gonna be research and like reviews and scientists outside of the pharmaceutical for-profit motive that are going to research the mechanisms of this stuff and actually do the research and publish the papers irrespective of the pharmaceutical company. So again, you're
Have you
conflating the
read
two.
the body of literature that supports and like studies on populations where like ivermectin was just naturally taken due to the locations of the population and their COVID death rates. And even thinking like Haiti, which has a very poor medical infrastructure, um, had no vaccines. I'm not saying, yeah, they didn't have access to the mRNA vaccines, and um, they had, like their mortality rates from COVID
So why is the
was
United States ranked 200th per capita? death rates then?
For you mean? What do you mean?
I mean,
Like
we lost 1.2 million Americans from COVID during the pandemic. So what is your hypothesis then?
um 1.2 million from COVID or with COVID? Like
From that
there's definitely
we had 1.2 million people die over the expected deaths. Why did they die? Why did those people die?
you mean like in excess mortality
Yeah.
during that time?
Mm-hmm.
Yeah, I mean, people were dying from COVID.
Yeah.
We
Yeah.
didn't really
1.2
know.
million people died. Yeah.
Yeah, we didn't really have any effective treatment.
We
People were
did. We did. We
people were
had
thrown on
vaccines.
ventilators.
I
People
mean,
were thrown on
300,000
ventilators.
of those 1.2 million is from vaccine hesitancy.
Yeah, but it doesn't kind of dispute my examples of like the population of Haiti and other countries,
Okay. Then
third world.
why would the United States do so poorly if like
I mean that's a good question. I
if
mean
it's
we
so
have
easy and it's so cheap and
pay
so then the United States should
we
be like one of the best.
we paid the most for health care with the
Hmm.
worst outcomes in the world, right? So like using the argument that with all the medical infrastructure that the US has,
Yeah.
like we're definitely a sick nation. Um,
Yeah.
I do remember at the time, like we didn't really know how to treat COVID. Like we were putting people on ventilators, and
That's
found
because
out
people
later
had pneumonia and they couldn't breathe.
yeah, and that turned out to be a death sentence. So they had to
No, it
like
didn't. No, it didn't. The
once they
death
figured
sentence
that
was
out,
them having a COVID and they couldn't breathe and they had pneumonia. It
yeah,
wasn't the
yeah.
ventilator that was the death sentence. It was the
Well, it
fact that
turned
they
out
had COVID.
it was like burning their lungs.
No, no, that's
They
all.
like we
No,
stopped like remember the whole Operation Warp Speed, and we were trying to
no.
get ventilators out there,
Yeah,
and then
yeah.
we
They
discovered
needed it.
that like yeah, and then that's not a treatment anymore because
Well, because they got
they
better. They have drains now for inside of the lungs. They don't.
Mhm.
The ventilators weren't. I've gone through this like, and it doesn't. People say, oh, they made money by putting them on ventilators, so that they were putting them on more
Why would they
than
make money
much,
on
and
putting
it
them on
wasn't.
ventilators?
Huh?
Why would they say they'll make money putting on them on ventilators?
Be,
Who said
be,
that?
because it was like a way that the hospitals could make money and inflate the COVID patients. So the impacts of
That's
ivermectin on
the
COVID-19 outcomes, a systemic review and meta-analysis,
Mhm.
Annals of Medicine and Surgery, February 2025. Conclusion: despite its observed benefits in symptom management, ivermectin did not significantly influence critical clinical outcomes in COVID-19 patients. These findings highlight the importance of continued research to identify effective treatments for COVID-19. So, but I mean, there's
Yeah,
just
but you should you and I both know that like when it comes to looking at evidence, you want to look at the whole body of literature, and I think
debate talk. I know
and
they exist, dude. It's crazy. I know.
yeah, I mean like and and that's where maybe some biases comes into play, but and
I'm
then you
biased
just
for sure. I'm biased towards science. I mean, absolutely. Yeah, 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 for
I think
sure.
you're
Just
biased
like
towards like authority.
no, no. I'm
Yeah,
biased towards
like
science. Like there's
like
no.
institutions. Like I think which is not wrong. I'm not giving you criticism for it, but I think like when it comes to like say, for lack of better words or for lack of better phrase, like institutional science, then that's like kind of like your gold standard, and anything that might go against the grail would you just completely disregard it.
No, that's not true. Yeah.
Has there ever been a case like that where you thought like where like you do I mean like you do I think I correct you do think the CDC recommendation for only healthy people or not recommending it for healthy people is like
Yeah, I don't
maybe
agree with
like
that. There's lots of times that I was critical during the pandemic of what was happening or being pushed out by the CDC. I mean, there was lots of times that I didn't agree that they were saying that you didn't have to mask anymore. I didn't agree with that. They said that you didn't need to mask at the very beginning. I didn't agree with that. I didn't think that they said that you don't need a booster, and I didn't agree with that.
Yeah,
And I got a booster. I got a booster before they were even doing boosters. I got a second first shot. So like I was, like I mean,
yeah, that
so
was the. I mean, the CDC is one thing, but like study. I mean, I think the CDC is like more of an organization rather than like a study. But yeah, I do agree with you. Like they were. I mean, I think the mask thing was like they wanted for PPE or
mhm.
for emergencies or responder or medical
It
staff.
was awful. It was completely wrong, and it
But
was it was
saying no
stupid.
mask is ridiculous because you don't want to be inoculated by the virus, and the mask prevents that.
Yeah,
The viral load. So
exactly.
yeah, well, I think um, I'll send. I think I'm on your Discord, so I'll
Okay.
see if you're interested. I can send you the ivermectin and also like the population studies and in third world countries with how their health outcomes were.
I
And
mean, what their health outcomes were is like they actually isolated a lot. It's pretty simple. We never actually like lockdown for a lot of
yeah,
the stuff, so that we never like I mean we did enough to actually make one of the flu strains extinct, which is kind of ironic, but the isolation and the masks were good enough for that, but it wasn't good enough for SARS-CoV-2.
yeah, yeah. I think that the lockdown. Uh, I mean, I think in theory it works. Like if you were to lock down and put everyone in isolation for a month, with no contact, or it just. But I think like realistically, um, that's not really possible. I think like the people who get hurt by lockdowns
Mhm.
are the most vulnerable. Like I think I was reading like, due to the supply chain,
Mhm.
like some countries like ran out of food, and so like the most like like because when we think of lockdown, it's like, oh, we don't want to spread the virus to like your grandmother or whatever. But that's like, I mean, it's a really large privilege to go on lockdown, and not everyone can do it here in
I
the
mean, that's
U.S.
what the
alone. But
government should have facilitated. I think that they
yeah,
should have. They should have delivered meals. They should have made DoorDash, free for everyone for a couple months. And hi, Dr. Davis, nice to see you. They should have made it facilitated that. That's the whole idea of a federal government, man. That they can like for public health actually make things facilitate things that wouldn't be normally possible.
yeah, yeah, yeah. That's something that like, I mean, we went through lockdowns. I just yeah, I just don't
I don't
think
think that we
like.
actually did, dude. There were suggestions, and like the GPS location data says that basically nobody locked down except for higher socioeconomic strata people. So basically, like managers and that with laptops. It wasn't like a full shutdown. Schools were closed. Sure, like that was the thing that did happen, but it's not like we had mandatory vaccines like a lot of people say. Like we had it for some really small amounts of people, and some of the vaccine mandates were shucking down by courts. It was for like aren't like people in the military, and it wasn't like everyone got vaccinated at that 95%. And it's actually kind of it's really sad too, because the efficacy of the original SARS-CoV-2 vaccine was insanely high. It was like 94.3% or something insane when it's normally like 60 to 70% on a flu vaccine in a good year. So
Would you
it's
like, if you were emperor and you had this pandemic happen, would you say like lockdown mandatory vaccines for all citizens and be done with?
I mean
Like,
1.2 million people, dude. Like I mean, I don't think that you should like jail people inside their houses, but like give people like
that's
DoorDash
what
for
kind of it.
free, have people go door to door with vaccines, and like wear all the PPE, have people mailed masks, which what they were going to do, by the way. Trump overrode that. The USPS was gonna do that. But yeah, dude, I think
Mhm.
that like free DoorDash for like 2 months, free DoorDash vaccines at your door. Everyone that's tested while they're getting vaccinated, then you delivered Paxlovid or some type of secondary care. Or I mean, there's lots of different ways that we could have done it. We could have tested everyone that came in through the airports, and we could have quarantined them and made sure that they were SARS-CoV-2 negative before going out. There's lots of different ways that we could have done. It's like the whole like we tried nothing and we're all out of ideas kind of thing. It's like we didn't do the same things that even the CDC recommended in their own plan. That George W. Bush, by the way, he like read about this about a pandemic when he was on vacation, and he was like, wow, the CDC is not really that prepared. We're not prepared in the United States for this. So then he established the pandemic task force. Obama puts more money into it, and then because of Obama supporting something, Trump comes in and slashes the entire pandemic task force, by the way, that the CDC had. So it's like, we tried nothing, dude. We're embarrassed. We should be embarrassed by how poorly we did, man. For real. We were like 200th in the world. It's embarrassing. Misinformation killed 300,000 people in the United States, man. 1.3 million people. If you took all the combat deaths from all the wars in the United States history, you combined them, it's 1.3 million people. We lost 1.2 million to COVID, and we don't even recognize it. And instead, we have people spouting conspiracy after conspiracy, talking nonsense that they didn't actually die, that it was all fake. But I have people coming in on my lives, man, constantly talking about, because I advocate for public health. People come in and be like, yeah, man, it's crazy how many people that I knew died, and it's sad, and people laugh when I talk about it. Oh, you're still talking about COVID? Haha, that's years ago. You get over it. And it's like, what's wrong with these people, man? Can we not have any humanity, for our fellow Americans, for our brothers, our sisters, our moms, our dads from dying? Or I think it's patriotic and pro-life to be advocating for vaccines. I think it's patriotic to say that Americans shouldn't be dying unnecessarily. I don't know. That's just me, though, I guess.
Yeah, I respect your views. I think I think philosophically, I think I'd be like more on the side that like people should have the right to choose what they do with their body.
But at what point? What point, man? Like let's say if it was 10 times worse. Let's say if it was 10 times worse, like 10 million people. What would you do then?
Yeah. I don't know where you would draw the line. Like,
what would you? Okay, let's figure it out right now. Let's say if it was 100 times worse. Let's say 100 million people were gonna die. 1 out of 3 Americans were gonna die. So that would our entire economy and our country would collapse.
I think the people who get the vaccines would get the immunity, but the people who don't.
That's not how it works. We just went through that. It's not how it works. When you have global spread of a virus, it evades your somatic hypermutation, so you're not able to do that, and it evades your antibody response. So we just went through that. If 1 out of 3 people were going to die, 1 out of 3 people were going to die from a virus, what would you do?
Yeah, I mean, like, let's say 1 out of 3 people, or whatever number that is, like, let's say 2 of them take the vaccines and the one decides they don't. Like, that person dies and they win the Darwin Award. It's just. But
that's not how it works. That's not how it works, man. Like that again. Like you're by having that many people unvaccinated, it lessens the effectiveness of the vaccine for the other side. Okay, let's change it. Instead of 1.3, 1 out of the 3 people dying from a flu. Okay, what would you do in order to prevent 1 out of 3 Americans dying from a nuclear bomb? What would you do then?
Well, can you rephrase the question?
A bomb is headed towards the United States, and it's going to exterminate 1 out of 3 Americans. It's so large that 1 out of 3 Americans are going to perish. What would you do? They're in the air right now. Make a decision.
I mean, what can you do?
They're in the air. They're in the air. What are you going to
do? Like a bomb, if a nuclear bomb.
Yeah.
But
what are you going to do?
I'm failing to see the parallel of what we were just discussing.
Tell me, what are you going to do? What are you going to do? I mean, what are you going to do?
Spend time with my loved ones, and
you're just going to let it happen. You're just going to. I would be like scrambling, airplanes, anti-nukes, figuring out evacuating those people from that area. Like there's tons of things that you could do.
No. If the ICBM was coming over, like depending where it comes from, it's like gets here in like an hour, 20 minutes or
And
whatever from
you
like
just let it
the
happen.
there's like unless if you're gonna get hit, unless you can like fly away while it's coming towards you or have a bunker of some sort, there's nothing you can do. You're completely helpless. Like we went to school and learned to go into the desk. If a nuclear bomb missile attack happens, but that was just all for sure. That was all theater. If a nuclear bomb happens, you're just dead.
No,
You
dude.
know,
I'm
if you
saying
don't if you don't if you don't
it's
die,
in the
if you
air,
don't,
it's coming at you, and there's ways of preventing it, and you want to do whatever you can in order to prevent that from happening. That's the
like
idea.
if I can't evacuate where like I'm not gonna die from instantly from the blast or outside like a severe radiation zone,
Exactly. You would
then
evacuate. You would
you
evacuate that
just
area. Exactly. You try to do whatever you can in order to get those people and save those lives.
no, like, I mean, if we're talking about this hypothetical situation,
Hmm.
and let's say like San Diego is targeted, and and people know, like it would be just mass panic. Roads would be clogged. You just kind of, I just be at home, just making peace with that. I wouldn't try to save
Yeah,
myself
dude.
because I think
I'm
I
not.
think I'm already
I'm
dead.
not. I'm not voting for you for president. I'll tell you that. You don't
I'm just
really
being
inspire a
real.
lot
I
of
don't want, I
hope
want to
from
be
me.
president,
I
but
mean, it's
like I
crazy
think
that the idea that you're just kind of like accept your fate, and as a country, we just kind of say,
I mean,
it is what it is.
in
Like I
that
don't agree
specific
with that, dude.
situation,
That's
yeah,
very like you're just accepting a thing. I think it's like a learned helplessness that people have, and
no,
it's not
it's
okay. And
actually kind of
we have the tech. The thing the thing is that unlike the analogy is not a one to one, right? Because we have we don't have the technology that can take out these nukes like that, maybe, and maybe we do have like the debate doc is saying that we have satellites and stuff in order to watch this, and but maybe we don't have the technology to knock the nuke out of the sky. We do have the technology, and we understand epidemiology, virology, microbiology, and we do
yeah. I mean,
know enough of that about the vaccines that we can have a bigger impact, and it's easier for us to prevent the the virus from spreading than it is a nuclear bomb going off. That's
yeah,
the idea. It's way easier. We have that technology. We have that ability.
yeah. I think the analogy you gave me was just a bad example because I do know quite a little about ballistic missiles and the interceptions of them, and like if
Okay.
you don't intercept it the first 20 minutes on its launch, it's going to hit wherever it's going to destroy. You can't just knock it out of the sky when it's coming down. So it's but if your city got alerted that something's coming over in like 20 40 minutes, like yeah,
But
you
dude,
can run.
the analogy. I mean, I was just trying to see like where a different technology, but even with the same vaccines and viruses and all that kind of stuff, you still wouldn't have done anything there.
No, I think
You
I
still
think
would
I
have
think
said you just kind of let
that,
if it was a virus that was taking out one out of the three people, you still wouldn't have done anything.
no,
So it's
I think
like
this
that's the
opportunity to
crazy
learn
thing. Like
small.
you think that we have to like just accept
No,
it. You're a
not
pacifist. You're a
no, that's
pacifist
not
in the versus viruses. You're taking the virus's side.
that's a completely wrong take because we were
Okay.
talking about you were saying about like the question was posed if you're emperor, what would you have done,
Yeah.
and that led to lockdown, mandated vaccines, DoorDash deliveries,
Yeah.
and then I posed the question myself. I was like, well, yeah, I mean, yes, that should be good, a
Okay.
good bit when it comes to like um you know like I'm more a choice of like um what a government should do. It should maximize the freedoms of the citizens.
But the
So
freedoms relies on
more
people being
choice.
alive, bro. That's the thing.
Yeah,
Is
yeah,
that and it's also the freedoms for people with genetic mutations that have bad immune systems, or they have cancer and they have the ability they're on drugs in order to not go out, like those people, and that liberty also has to be seen. And a lot of people, by the way, once you're over 60, the idea that we as a society just write you off and say, well, it's a good chance that you die in the next pandemic, it's just what you got to do. I mean, I don't agree with that either. I think that in order to be free, you have to like have your entire life has to be, okay. And it's not like you're expired after a certain time and you have no freedom after a certain age. And a lot of
I
people
guess
write people off, and because a lot of people, like 60% of the people that, died, over the age of 60. So people just write them off and just be like, even though there's like 15 million life years that were actually saved by vaccines. So it's not like people that were just like super, super old.
yeah,
It's like,
I think like those vaccines should be recommended and be educated and highly but I think when it comes to like forced and mandatory vaccines, I I I think personally for me that's like too authoritarian.
okay, so how
Because I
about,
think
so
like
you can mandate a couple different things, right? You can make it mandatory, so then you face a fine, which is like how Germany does it. Or in France, you face a fine. You can make it
Mhm.
mandatory in order to join public schools, like in the United States,
I mean,
or
we
in the
did
Australia, you actually get paid $8,000 in order to vaccinate your child for that year. What do you think about that? What about
I
paying
mean
people
we do
$8,000 in order to vaccinate their child?
I mean I think that's a good policy. I mean
Okay,
like
I
if
agree with it.
well,
I
no,
think it's cool.
yeah, I think like that's like if the outcomes that saves like the financial like it like saves in the end like for the
Mhm.
individual and not taxing the medical system, that like I think that's
Yeah,
just smart.
exactly.
Um but but we did like we have like you can't go to school if you don't have vaccines. So it's basically compulsory. I mean like
Yeah.
I remember during COVID like certain sectors, military, health workers, um, those are the prime examples. Like, couldn't work unless they had the
Good,
vaccines. So,
good,
yeah,
good.
yeah. So,
Because if you're not following medical advice and medical science as a
yeah,
doctor, like
yeah. But I don't
what
think.
other things are you not going to practice? Are you not going to follow? Like what else?
Yeah, but,
What are you just going to like improv yourself? I mean, that's so dangerous, man. They're just like factoring in like what they want to observe on the
yeah.
fly.
I mean, like in some ways, we do kind of make it mandatory. I mean, we don't like when you do mandatory vaccines. I'm thinking like if you refuse, it's like a criminal charge. That's why, like, I think like so like that's why I say you can't really force. You should do everything you should do to like educate, incentivize, and and make it as easily accessible as you can.
Okay.
Um, that's but yeah, but when it
So you
comes
think
to
during the pandemic, what if we had made it DoorDash for free for 2 months? You get vaccinated, you get $1,000. Like what
yeah,
you,
I think that would have been much more effective policy.
okay, all right, that's a
Yeah,
good place to end
yeah.
it. That's a good place to end it. I think that those would have been two really good things that we could have done that would have helped.
All right, take care, Greg.
Okay, all right, have a good one.
Bye.
I agree. I mean, Dr. Davis, I mean, it's just a way in order to keep people in their homes. So the problem was that people that were like, they weren't actually locking down and they were, still forced in order to be at work, even though they weren't essential. Like everyone was considered an essential worker, and the GPS and the phone data, show that. So, all right, guys. All right, Gemma Jewel. Oh, Corey, nice. And I saw someone else got vaccinated today too. That's awesome,
Yes,
dude.
I did. And I want to encourage other people to get out there and do it now while
Nice.
we have it available to us. It's incumbent upon every one of us in the country to protect our neighbors during public health crisis.
Nice. I
So I
totally
think it's
agree.
imperative.
How many vaccines did you
But I
get today?
really, too, I got the flu in one arm and
Nice.
COVID in the other.
Oh my gosh. So that's
This is my ninth
176.
shot. My ninth
Nice.
shot.
All right,
So I
three,
want
two, one.
everybody.
1 second. We gotta celebrate you. 1 second.
Oh,
3, 2, 1. 176. Thank you. Thank you, Gemma Jewel. Thank you for getting
thank
vaccinated.
you.
Every
So
single
one of the
shot, every
reasons,
single time. Thank you so much. Go ahead.
sorry, my first time here. I'm just excited.
It's all good.
Dr. Keisha Davis, if you're not following her, just to your audience, you need to be following her in the Medical Collective. They are a brilliant group of doctors,
Absolutely.
and they do wonderful lives, and they do a great podcast. So please follow her as well. We as a
I agree.
society have a responsibility to our neighbors to protect our neighbors during a public health crisis. It's imperative. The first 2 years of COVID, I did COVID investigations for law enforcement and military personnel. It is the largest loss of life in the history of law enforcement was C-19. Let me repeat that. The largest loss of life in the line of duty was C-19 in 2020, 2021, 2022, and 2023. You don't have to believe me. Go to the officerdownmemorialpage.org, odmp.org. Largest loss
Wow.
of life in history in the line of duty. Why? Because it was politicized.
Mm-hmm.
Never in the history of our country did we see a virus get politicized until we had the Trump administration.
Yeah.
We need to stop making this about party affiliation and remember that we are a country that needs to protect our people, everyone within its borders, because we are the walking petri dishes for viruses. It lives within our bodies. It stays in our sinus cavity for up to 14 days. You can be a silent, asymptomatic carrier, not know you have the virus, and you go home and you give it to your entire family. And I will tell you that one of the hardest things I ever had to do was to get on these calls and tell people that they had been exposed to give them resources, and I was hung up on. I was told to go jump in a lake. I was told many, many horrific things. And then 2 weeks later, I was getting the call. I talked to you a couple weeks ago. I hung up on you. I cussed you out. I said this and that. My entire family has COVID now.
Oh my gosh.
Or the
yeah.
call that I would get that someone had unalived because it took hold of somebody who had an underlying condition. We have a responsibility during public health crisis to take care of ourselves, our families, and our neighbors. A public health crisis is not a personal choice. It means that whatever's in you can spread to the next person and cause harm. So do yourself a favor and do the favor for others in your life. Get vaccinated and listen to the science, because we as a society have a responsibility to protect ourselves and our neighbors. That's all I wanted to say.
Yeah.
Officer Down Memorial Page. And please support all of your medical physicians, not only on TikTok, but on YouTube, Substack, because they are going to be who we need when the next virus hits. And I don't want you to be one of the people that they shut the door on because you called everything a hoax. We have a responsibility to support the medical people in our society and give them the love that they showed us during the most heinous loss of life. 4,000 lives a day were being lost under the Trump administration.
It's wild. It's awful. I totally agree with you. Amazing. That's really interesting about the Officer Down Memorial. I mean, I didn't realize. I mean, it makes sense. It makes sense considering how many people and they're exposed, obviously, right? And they're going, and even with proper PPE, it's going to be tough as an officer.
Many of them weren't wearing proper PPE. That's the problem. We're talking about every officer you can think of, from parole agents to FBI agents to correctional officers, Border Patrol, across the board. And if you go to the Officer Down Memorial page, they will show you each year how they unalived, what type of loss of life in the line of duty, and they kept impeccable records. And it is the largest loss of life. The numbers are you can't even argue them. And Texas, ironically, Texas, who wants to deny science and deny rights for many people, Texas has the largest loss of life in their law enforcement community.
Dang.
So please, I mean, use that as an example when you're talking about this, because we're about to see an uptick again. You know, I'm literally in a household right now where my son is sick with C-19. Thank God he's vaccinated. He just got Paxlovid, so he'll be helping to So that's another thing we need to talk about is if you are unlucky enough to get the even if you're vaccinated, you can still contract it. Make sure that you know what's available to you. Contact, even if you do an at-home test, contact your PCP, contact the CDC, make sure there's a record that you have caught it, and that way there's statistics. That's how we as a country have statistics. Get the prescriptions you need, stay hydrated, hot liquids. Make sure that if you have any breathing problems, you're contacting 911. You're not sitting at home waiting for this to just go away. We don't want you to be one of the statistics that doesn't make it. So please do your due diligence to listen to the science.
I totally agree. I was looking, I mean, I'm on the odmp.org,
Mm-hmm.
Officer Down memorial page. This is interesting. Never knew about this.
Mm-hmm. Go to
Is
the search engine and type in COVID-19.
Oh, okay, that's it.
And it'll literally bring up every single year, 2020, 2021, 2022, 2023, 2024. I don't know if they have any statistics for 2025. I'm not on it anymore. I'm not doing
Yeah.
the investigation works or the contact
Okay.
tracing, but for the first 2 years, doing it was heartbreaking.
Yeah. Man, this is very interesting. I didn't know about this as a resource. Thank you.
You're
Appreciate
welcome.
you.
So just please make sure you use it for education purposes.
Mm-hmm.
Remember me if I come back. I type in caps because I'm visually impaired. So
Okay.
forgive me to your moderates. They were pretty kind to me. And thank you for questioning me. What was his name? Ducray, thank you
Yeah.
for questioning me so that I could get up on the panel and have this conversation.
Yeah.
It's imperative that we're in this together, you guys.
Mm-hmm.
We're not expecting anybody to rescue us. We're in this together to rescue each other, protect the ones we love, make sure that we're following the things that protect our civil rights, our human rights, our women's rights, our educational rights, and a belief in science and math. Stop negating the reality of who we are as a society. If we're not taking care of each other, there's no one that's going to be taking care of us.
Exactly. Dang. It really
Really
well said.
And
thank you.
And please invite the other doctors when you get the chance, like Dr. Keisha Davis, Dr. Sharon Smith.
Mm-hmm.
If you get Laughter and Light or Dr. Rubin, an opportunity to speak to them. These are brilliant collaborations that you could have, and I think you could have wonderful panels. And I think you would do well doing that. The Medical Collective, again, for Dr. Keisha is brilliant. So if you're not following her, and Dr. Atusa, yes, thank you, Dr. Keisha. I was trying to remember all my doctors. Because with all of you working collaboratively, you're going to be the heroes of our country, because we have negated the doctors out there, all of you, PhDs, obstetricians, pathologists, internal medicine, allergists. It's imperative that we listen to all of the doctors collaboratively, giving us the information we need to protect ourselves and our families. Thank you so much for letting me up. I appreciate you.
Yeah, absolutely. Anytime. Yeah, thank you so much. I appreciate you. Thanks for coming on and speaking your truth.
And please follow me back.
Okay. Yeah, for sure. Sure. Done.
Thank you. Appreciate you. Good night, everybody.
Awesome.
Get vaccinated.
Yeah, I love it. Get vaccinated. Thank you so much, Jem. Thank you for coming on. That was awesome. Wow. What an advocate. That was really cool. That was really awesome. Yeah. Incredible. Yeah, Fauci was great. I think he did a good job. I thought, Rory, I thought you had some misinformation up here that I wanted to respond to, but you said so many things. Anyway, I'm sure you'll say it again. All right. Skog.
Hey, Doc, how's it going?
Skog, how's it going, man?
I'm doing pretty good. I actually have some good news for you, or something I'm very proud about. So I've been hosting a couple science lives recently for the past 2 days. The first one, I was able to just communicate with some of my peers on here. I didn't really get any opposition. Shout out to Debate Doc and Mitch the Scientist. They were very informative people I was talking about. Today, and actually yesterday, I was able to have some opposition on. And I was able to have some very interesting conversation. First and foremost, yesterday or 2 days ago, I was able to actually convince two people, and this is like, to me, this is a minor accomplishment. I was able to convince two people to go potentially get their vaccines.
Nice.
There were people who were on the fence. One of which was an individual who had some adverse family history with vaccines. We were able to convince her to try to just set up an appointment with your doctor and just talk to your PCP about these concerns and everything. And she said she will do that. She said this was a good catalyst to enable her to finally get that courage to talk to her PCP and then potentially get a vaccine.
Nice.
And the second one was someone who was very anti-vax. He had his contentions, but slowly, it was a 2-hour conversation. But slowly, I could even hear it in his voice. He was actually like realizing the logic and the illogical statements. He had a misunderstanding about how vaccines function. And he was slowly able to kind of get an idea. And he said, you know what? Like he said before he left the live, I'm not sure if he'll get the vaccine, but he said, you know what? I'll set up an appointment with my doctor. I realize there's stuff that I need to learn and I need to discuss with them. So to me,
Nice.
that's still a positive that potentially both of these people are going to get vaccinated.
Nice, dude. Not very nice. That's really cool. That is really cool. I think it's like,
Yeah.
I mean, it's so, vaccines are truly the way that we can impact our, our local community and use science to better inform our lives and stay healthier, keep our friends and ourselves and everyone around us healthier. So I think it's amazing. It's such an easy win. I think that.
Yeah, I know, and it's so rewarding, right? Like I actually feel happy. Like I said, if anything, I already feel like I got a birdie. Like I'm doing already better than I thought. I got like on par to me would have been just having one opposition a day. So far, I've been able to communicate pretty well, and really this is to help me become a better science communicator. Just for some reference, I'm trying to apply for medical school, and I want to do whatever I can to just be the best me to both be a better scientist and also just be a better communicator in general. And
Yeah.
this is kind of assisting with that, and it's really fun, honestly.
Yeah. Nice, man. Very nice. Yeah. Yeah. I think it's interesting to talk to people like that because it's like, how like did you come to this idea? And a lot of people are just they'll say, oh, I just saw a video or I saw I'm just asking questions kind of thing. And it leads people down a road of conspiracy because it's an easy way to explain a complex problem. And it just seeps into their brains and they can't get rid of it. Unfortunately, it's awful.
Yeah, and I can imagine sometimes like the two people who I just referenced, to me at the very least, it sounded a little bit rational, like where their approach was coming from. It's just that they weren't informed about this is the truth, this is what's actually happening, this is what an mRNA vaccine is.
Yeah.
And when you get a vaccine, for example, the individual who was very much anti-vax until that live, or a little bit less opposed to vaccines, they for some reason were thinking that the vaccine was the same as the wild strain versus maybe something when talking about another vaccine such as being an attenuated vaccine, or in this case where the C19 vaccine, it was a mRNA, as in even the most basic sense of what we're looking at for your body to adjust to and be exposed to that a virus in the most optimal way.
Yeah.
And it was just a misunderstanding on that part, and they weren't really familiar. And then maybe like I hope it was that, like, rewatching the live, I think that's what kind of I could hear in their voice the way they switched up and they're like, wait, is that true? I didn't know that. This whole time they thought it was pointless because they thought you're getting the same thing you would get at the supermarket versus a more attenuated version. And I made an analogy. It's kind of like your body. It's like going to I mentioned the match the other night. So it's like going to do a UFC match, but you never seen that opponent before in your life. If you practice against that opponent and understand their weakness and understand where to punch, that fight's going to be over really quickly. Versus if you've never seen this opponent before, it's going to be a rough match. That's how your body does against certain viruses. When you're familiarized and your body's immunized, the reaction, the secondary response is not as drastic because, or even drastic at all, because of the fact that you're able to take down that virus optimally without freaking out in a way.
Yeah, exactly. Yeah, and that's the benefit of the RNA vaccines too, is that they're exactly the same. They're exactly the same. They can change the sequence so easily and so quickly as well. Because like making like a live attenuated vaccine, it takes a long time. Versus when compared to an RNA vaccine, I think the lead time is like 11 days from like just
Wow.
making it like from start to finish. It's incredibly fast. So if they actually wanted to change the sequence, it could be done a lot more quickly. That's the benefit of the RNA technology.
Okay. Wow. Yeah. I didn't even know it was that efficient regarding all that.
Yeah. Once they have things going, once they have like the sequence and it's then you're just in vitro transcribing the from the DNA and you're purifying the RNA. It's very quick, so wow. it's amazing.
And
yeah.
Where do they synthesize, like when they're constructing, because I know some vaccines when they're constructing, they use like chicken embryos For mRNA vaccines, do you know if they use chicken embryos or do they just use something else?
No, they don't need to. They just have the DNA, and they have a vector, and then they in vitro it's called in vitro transcription. So in vitro outside of the cell, and they just have the enzyme that just makes the RNA from the DNA.
Wow, okay.
And then they just straight away.
Awesome. That's I had no idea it was that efficient. So I'll keep that in my notes now.
There's lots
And
of
I'll add to it.
there's lots of like benefits to it. It has to be cold, obviously. It's like a process that needs to be done so that you can keep the RNA working and viable. Synthetic DNA or real. I mean, so it's the same. They're both all DNA is DNA. I mean, nucleotide is going to be a nucleotide. So, but it is synthesized, by, you basically just order it. I mean, it's so easy. I mean, like literally, like within 12 hours, you can have a piece of DNA on your lab bench that has the exact sequence that you want.
Absolutely.
It's so fast. So it's super fast, and then you just clone it into the vector, and then that takes maybe a week at most. So
wow.
And then you can make it from there. So it's incredibly fast.
What's the turnaround time for something like a attenuated virus or a
dude? That's
like
really
maybe would have grabbed the vaccine.
A vector is like a vector is like kind of like the chassis that is like the thing that's like the think of like the semi truck, the box, is kind of like the semi truck is the vector, and then the payload is the thing that's resting on the thing, or a pickup truck. The pickup truck could be the vector, and then whatever is in that box in the back of the truck is kind of like the DNA sequence, and you can just put it in and put it there. It's also like it's usually the form that a vector takes is usually a plasmid. So then the plasmid. Oh, we got a vaccine. Sorry, I got my flu and COVID vaccines today. Melanie, let's go. Thank you guys.
Good job, Melanie.
All right, we're going live in 3, 2, 1. 178. Good job.
Congratulations.
Good job.
And Doc, I do have one more question because the individual was on my live, and their name was Matthew. And they said they were familiar with you, and they debated against you as well.
Okay.
Regarding vaccines, they brought up a lot. They're anti-vax. They believe in terrain theory, and the truth is, what I told them is I took down notes on what they were telling me. I don't really I told them I don't really agree with much of this, but I cannot at the moment formalize a good counter argument because of I just need to sit down and be able to read all this and understand and get some literature. They brought up some points, and I thought maybe if I discuss them with you real quick, I can get some more information, and you're absolutely more familiar with all this.
Okay.
And topics they brought up. Could you first off tell me what is VAERS? Like I hear that get brought up. I'm not really familiar with it exactly.
Yeah, it's vaccine adverse effects reporting system. Yeah, vaccine adverse events reporting system. So it's basically like a big bunch of adverse effects, that happen. So you can put it into the pool, and there's basically Hi, Dr. Davis. How's it going?
Hey, how are you?
Good.
Hey, Dr. Davis. How's it going? Good to see you.
Good to see you. So when I heard VAERS, I was like, oh my gosh, I know they try to do this. So imagine it being a hotline where people can call and lie about the things they put on the hotline. Somebody became the Hulk after taking the immunization. Somebody claims that they were doing crimes because of the immunization. So it's a reporting system. It's not a factual. Then after all the stuff that gets reported in there, they go back and verify, right? And
Okay.
was layered versus actually what we use to track adverse events. This is not it. This is the vaccine reporting system where people can call in and say what they said and what happened and why they had to start monitoring it as people were doing exactly that, just making it, falsifying a lot of stuff. So people go around saying, well, VAERS said this, VAERS said that. VAERS doesn't mean anything because anybody can call it and make a complaint.
So it's kind of like the Wikipedia, if you will, of like virus complaints, because anybody could edit it or say anything. They just report it because
Google reviews. Yeah.
You can look
okay,
at,
wow.
so you can go into Google Scholar and you just type in VAERS and COVID, and you can see like the papers that do use VAERS like scientifically, and you can see their methods section, how they have to like do secondary checks to make sure that there's an actual event. There has to be all these types of information there that they can actually use so they can be used in the study. So it's a lot of like incomplete information a lot of times, and it has to be corroborated with an actual event.
Okay, and is there
physician reporting is different. This is not where the physician report.
Okay, is there any other more reliable website for something like that, or like anything in particular that's like a universal thing that's more physician tested and vetted before they upload any complaints, or is that not a thing?
Yeah, there is. We actually talked about it. And I implore you, you follow Dr. Tusa. We did a whole episode explaining this reporting and all of that and vaccine. Every child
Okay.
has access and another one. But I personally think that people are using VAERS because it's easy and it's something that they're going into, and it's making anti-vaxxers spread their misinformation. Okay. The way we report it, there's tons of articles on it. But what I would implore people to do, and what I'm going to start doing, is instead of talking about the immunization, because we already know what it does, right? At this point, we've worn it into the ground, is to talk about what these viruses do to our body, which is what I start to share. Is to show what C19 does to the lungs. Is to show the microclots. Is to show the clots in the brain. Is to show what happens to a man's testes. They'll care about that it actually can change your fertility and actually your sperm quality and quantity, to show what's happening to the placenta, so why a mom's baby can't get the perfusion and the nutrients it needs, to show those type of things. And the long COVID, which is going to continue to affect us. Same thing with measles. You worried about the measles virus? Well, I tell you what, why is it that a child unalived 5+ years after having it is because there's long-term complications with viruses. So start to show those. I went into a room one time and I simply just said, well, I can tell you what I see in an autopsy. And all of the naysayers, all the people like in the chat now, saying, Dr. Davis, you don't know what I'm talking about, but yet you do care about my cancer diagnoses, is to look at an autopsy. You want to see the organs? Let me show you what they look like after disease, after these viruses wreak havoc on them.
Wow.
And the fake clots too. We don't do autopsies at a funeral home. It doesn't happen. That was a fake picture taking. They'll show you the picture of the vaccine clots. But that picture was also doctored from an actual autopsy of the clots that happened after C19.
Wow. Actually, one thing I did talk about on my live was the effects of long COVID. From my understanding, it could range so far from things like not only just losing your taste, but like vertigo. Like, was that correct to say?
So the losing the taste is actually an acute virus, right? We're saying, and actually we do see the virus in the olfactory nerves and the olfactory system. That's what they believe where that anosmia happens, and then it comes back. But the long-term effects are actually an autoimmune phenomena, though some brains did show some findings. I went through, I'm going to send you, I'll put it in my Substack actually. I had a neurologist. Every time I have these conversations, I make sure I have a specialist in the area. I had a neurologist come on and we did a whole thing called Pathology of the Brain on COVID. And we talked about long COVID on Clubhouse. It was like a 4-hour conversation, broke down organ by organ, neuron, talked about all of the changes. She talked about brain fog being the most common, 2 people having other more severe neurological issues. Dr. Lorna Breen was a physician that passed away from C19 by unaliving herself, but she was a completely high functioning. She got C19 before we had the immunization. She was treating a patient and got it from the patient, and she developed a deep depression because of that.
Oh wow!
So yeah, the ranges of the things that C19 can do neurologically are astounding.
Wow, I had no idea about that.
It's called the Dr. Lorna Breen Foundation, which actually former President Biden had enacted and Congress had enacted, and we were working on it because it was going to help healthcare workers. She was afraid to go get help for it because a lot of healthcare workers, we don't get, if we say that we had mental health, when we get our certification or get licensed to work or practice in a hospital, we have to go through credentialing. It's used against you. So the Dr. Lorna Breen Foundation, the brother-in-law and the sister, after she passed away at the beginning of C19, they started that foundation. And now I don't even think it's getting funded now. That was supposed to help with mental health of healthcare workers because this administration doesn't want to help with it.
Yeah. Wow.
It's awful. Yeah, long COVID is real, guys. It's a real danger. And we had someone come on, their kid was impacted by vertigo, hearing loss. People, their partner also had their taste didn't come back. It's like, it's happening. So,
wow.
Yeah. And children have something a little different. It's a multi-systemic inflammatory response, mirrors. We talked about that too. That's a little different, but we're seeing that and have seen that. Not as common as adults, but here's the kicker with the long COVID is that it doesn't matter how virulent the strain is. You could have an asymptomatic infection and get long COVID.
Oh, wow. Okay. It just manages to have that type of response regardless of one's immune response to it.
Yeah.
Okay. Wow. Mm-hmm. I do have another question. This is regarding, so again, that individual that I was talking about, they brought up terrain theory, which I know is a very funny term that is shared on this live. Doc, are you able to shed light on just what is, because I couldn't fully understand it and I just want to understand it, like just where they're coming from. What is their claim or what is their hypothesis regarding that? Like regarding that theory?
It's basically like whether or not you're an acidic, basically the idea is that these particles are coming from their environment, and their environment are like dead cell matter and stuff like that, where a cell will like lice or something. It's basically coming from that stuff. The original terrain theory was that it was acidic or basic, and that would repel or attract these little particles. But a lot of people nowadays will kind of take it and say that it's because of some type of, basically like the bacteria shedding this type of small stuff, and it's kind of like an amalgamation of badly uninformed germ theory and microbiology with, basically they just don't think that viruses cause disease. I mean, that's basically what it is, so they don't accept like Koch's postulates, which is kind of like a foundational understanding of how a virus and a pathogen will actually cause the disease. So it's just yeah, man, it's tough. I mean, it also conflates with like the idea of miasma, which is the idea that
the old ancient Greek concept,
bro, you got to go back to like literal Pasteur's like experiments and the swan necked experiments and stuff like that, where it's I actually, one of my goals I have written down for an idea is going through all of Pasteur's like his old experiments, because it's like, it's interesting because I guess it's new again or something. People don't
reinventing the wheel here.
Yeah.
So that's interesting. Wow, I didn't. Actually, there was once on a live I had to explain to someone, like maybe it was just because their educational background. I wasn't trying to make them feel bad about it, but they for some reason believed in spontaneous generation. Like I had to explain that one old. Do you remember that old like ancient medieval experiment where they put a glass thing over like meat, and then they said rotten meat doesn't produce flies. It's that flies attracted to rotten meat.
Exactly.
And,
no, that's part of it. What it is, right? Because their idea was that the viruses are basically broken down pieces of cells that they kind of like spontaneously generate from the cellular matter itself. Yeah, that's part of the idea. Yeah.
Yeah, so it's like we kind of had to reinvent the wheel or go back like to the ancient Greeks and like explain stuff that they knew. So this always ends up happening. Like even like another topic was globe Earth for mine. Like I had to explain like very simple concepts about how you can actually see the Earth being a globe, And I felt like I was talking to people from the ancient era about how their contentions. Just on that topic of debunking the terrain theory, a lot of times what I've noticed is that this individual, they brought up a lot of holistic herbs. Like they brought up turmeric, black walnut hull, wormwood, clove oils. I can imagine these things are very good for allowing a person feeling comfortable, or maybe allows to release the stress from a patient going through a process of suffering from a tumor or suffering from whatever stress. Why do you think that they always go to these herbalistic things over medication or other interventions, like medical interventions?
I mean, I don't know, man. I mean, a lot of people grift online and they try to sell people stuff, that's not FDA approved, and they see it and then they kind of get swindled into it. I mean, that's what I honestly think. So, Dr. Davis, what do you think?
Yeah, follow the money. I mean,
Yeah.
that's true what it is. We talk about all the time. Again, Dr. Lakatusa, a lot of my friends are integrative medicine. So it's not that they don't believe in natural remedies, right? But we believe in evidence-based medicine. That's how we practice. That's why I'm an MD. I believe in evidence-based medicine. And I find it funny when people say they want to be all natural, but you're driving your car, you're getting your Botox, you're
Ozempic.
you're exposed to artificial fumes and all of these things. So you're not in a natural environment. And we are exposed to things that we haven't been exposed to in the past. I just saw mesothelioma yesterday. I diagnosed it, I'm pretty sure it's a mesothelioma, malignant mesothelioma. So our environment is changing and causing disease and cancer unlike any other rate or time. So going to have your nutmeg or what is the thing everyone's doing now? Ugh, it's always changing. Oh my
Yeah,
God.
there always is some type of herb. Like
Sea
the other day
moss. No, it's
it
just
was
sea moss. Sea
sea
moss
moss.
cures it all. The sea moss cures it all. But yet, a lot of these things they send you are in a jar, powdered form. So they've been processed.
Mhm.
That's true.
That's true.
Because you should just be telling people to go get a garden.
Dude, you know what's funny? You know what's so crazy? Someone in my community runs one of these herbal shop things, and she was talking about last night how her shop that sells like green teas and stuff as medicines is all being hit by the Trump tax cut, the tariffs.
Oh,
The
man.
tariffs are increasing the cost of all of her stuff by 60 to 80%.
That's insane. That's funny. I mean, they hit themselves in their own foot there.
Yeah, exactly. So they're just like, wait, what's going on? It's just kind of it's wild. So yeah, exactly. It's all processed. It's all like super purified. It's wild.
Yeah,
I mean,
actually, one of my first jobs after college was I was an analytical chemist for a supplement lab, and we were testing heavy metals on supplements, and I would also see the other minerals as well. So regarding like something like calcium, right? And a lot of times, from what I was looking at, their levels were so low. Like they wouldn't market it. Like if you looked at the bottle, like they would obviously talk about the functional, like whatever they're marketing. For example, if it was turmeric, they would talk about what's the percentage of turmeric in here versus the dud in there, which is just anything else to kind of be a filler. It was so low. Like I was wondering, like this is very ineffective, and since this isn't really regulated by the FDA, I can't imagine like this does anything. Like I don't think there's a reason why this isn't really approved by anyone else besides some testing lab that this was sent to. So I like when I see these supposed properties about this is rich in this and this has that and whatnot, I get a little skeptical regarding all that.
Biznatch, let's go. 1, 2, 3. Nice.
Congratulations.
Sorry, every single shot, every single time, guys. Thank you so much. Sorry, go ahead.
Someone asked about testing for long COVID. There's not a single test. It's almost like a diagnosis of exclusion, and we had many groups that were working on this. There were long COVID centers, and there are probably no more, unfortunately. But it does require you going to your doctor, excluding anything else. Everyone pretty much has COVID, right? But it's going to be the symptoms, imaging, a whole bunch of testing to prove that it's long COVID, unfortunately. It's not an overnight diagnosis.
Yeah,
Wow. Okay.
it's tough, man. It's really tough. There's, it's really Physics Girl is a science communicator on YouTube that has a really interesting long COVID journey. She got COVID on her honeymoon, and she had chronic fatigue after, and she documented a lot of her stuff, and it's been years that she's been able to like actually do anything or go outside. And yeah, Physics Girl has some really interesting videos on long COVID. If you actually want to see like her journey, at least it can be very different for a lot of different people.
Will do. I'll look into that. And the last thing I do want to bring up is they brought up some things regarding, and this was something I was a little bit personal because they brought up, they unknowingly brought up my heritage, my country that I'm from, Pakistan. This is regarding polio. Polio is only located in 2 areas. I mean, from my understanding, it's Afghanistan and Pakistan. And for whatever reason, they kept on saying that there was or they did say, I shouldn't say they kept on saying, they did bring up this one point that they believe that somehow runoff or fumes from industrial plants might be causing that polio to appear. And to me, that's felt like such a non sequitur that we were on this topic of supposedly bacteria or terrain cells, whatever, unalive cells cause that. Then it went all the way to chemical fumes. To me, that was a complete non sequitur. But I thought a good response to that is that if you actually look at the regions where in Pakistan the polio there's a endemic of polio, it's within isolated regions where there's actually vaccine disparity. One example of that region is by the K2 mountain range, Khyber Pakhtunkhwa. In that area, this is just it's actually very difficult to get medical equipment or anything up there. Not only like chemical runoff because it's all the way in the like it's by the Himalayas on the mountaintops, right? So there isn't gonna be any runoff. It's far away on the other side of the country, away from a lot of where the industrial plants are. In fact, there's so little light pollution in that area that you can see the stars, right? Which is a rare thing nowadays in this very heavily industrial world, you know, especially like in certain parts of America, you'll never be able to see stars. But it's such a not impacted by any type of pollution. And the real reason why it's such an endemic is because of the fact that it is the vaccine, the disparity in getting vaccines. It's so difficult getting anything up there from food. And in fact, you can't even argue this stuff about DDT, for example. For some reason, people believe DDT causes tumors. They believe that it causes or sorry, not DDT, other pesticides. I was sorry, I didn't mean to refer to DDT there, but pesticides in general and whatever. These individuals don't use any of that because they basically are living in the Middle Ages. If you actually go and look at some images of that region, and the Chitral region of Pakistan, these people live very rurally, and they still have these endemics of these viruses. So to me, that's just kind of evident that isn't those many claims about pesticides to supposed pollution to this, that, whatever causes viruses. I think that kind of debunks that in itself. So I don't know if you guys have any input on that or if that was like a rational thing to say.
Dr. Davison, what do you think?
I'm sitting here trying to word off the chat. There's something in the chat.
I don't read that. Don't read that. Those people.
She wants to know the effect of vaccines. I asked her, does she want to know the side effect of viruses?
True. Very true. I think that's what we should focus on. I think people are focusing so much on vaccine side effects and not like what they read up about smallpox. Like, geez, that was gnarly. The vaccines did that. Science did, eradicated smallpox, not whatever the anti-vaxxers want. Yeah. Exomes. That's what people think. But yeah, Skog, I think I'm sorry, bro. I lost part of your question halfway through.
Yeah. So a lot of times they claim it's like pollution or whatever.
Yeah.
Clearly, there's people who are in areas that they're so isolated and separated from all these things. Like I think a very rhetoric they use is that the modern world sucks because we have all these chemicals everywhere. We're getting aluminum in our bloodstream. We're getting supposedly this and that, right? If you look at people who are in isolated regions who have basically the best I can explain it is that they live in the Middle Ages, stuck in like the Himalayan mountains, stuck in the K2 mountain range. stuck in Khyber Pakhtunkhwa, Chitral, Pakistan, areas so far away from anything you can imagine is industrial. They are still getting polio. They are still getting viruses because of their disparity from getting vaccines, their inability to get the proper vaccinations. I think, and what I'm asking is, like, do you guys think that's like a valid argument against that claim about this things causing, like, chemicals and industrial aluminum and all that causing viruses?
Well, they don't cause viruses.
Yeah,
They
I
transmit.
think
exactly.
those are two separate things happening.
Yeah.
Viruses naturally occur in the environment. Hence is why you've got to protect against them. Now, chemicals have their own set of issues that they can cause directly, right? They can be directly caustic to us, but I don't think it has anything to do with polio.
Yeah, no. Yeah.
Yeah.
But that is actually all I had to say. Thank you for both of you being able to communicate with me about this, and both of you are always welcome on my live. I always, if you guys ever stop by or whatever, feel free to say hi or even join up on a panel and add your insight and nuance. I appreciate both of you, and I learned a lot from both of you actually. So
Cool,
I really
thanks, man.
appreciate you guys.
Yeah, I
no
saw
problem.
Debate Doc on your live, and I was like, oh, what's going on there? But I was in dad mode, so I couldn't hop on. But yeah,
I totally understand.
thanks, man. Yeah,
But
I
yeah,
appreciate it.
yeah, have a
But
good night.
If you go to become pre-med, let me know.
Yeah, absolutely. Yeah, honestly, I'm retaking the MCAT. I took it. I got a 508. Some people, I was looking at a doctor of osteopathic schools, which I was interested in going. And some people say that for what I want to do and my aspirations, I might want to just focus on trying to go to MD. And the one thing that I have that I need to work on is my MCAT score. I think everything else I'm pretty solid on, GPA wise, experience wise, everything else. So I'll definitely keep in touch.
nice, man.
Definitely.
Yep.
Nice.
Well, take care. Have a good night, guys.
All right. Thanks, Scott. Thanks for coming on, bro. I appreciate you, man. Thanks for coming on too, Dr. Davis. I appreciate you. Answer. I feel bad getting mired in chat. That is the Wild West in there. But thank you for coming up. I appreciate it.
Oh, no problem.
You're always welcome to like request. I feel bad when I see you in chat. You're always welcome to come up. I just feel bad throwing an invite at you all the time. I figure sometimes you just want to chill and watch. So, but you're always welcome to request.
Well, thank you.
Yeah,
And just a couple of things in the chat. I think they're getting a lot of things confused. I know the person with the tea. I don't think there's anything wrong with drinking tea. COVID and polio are two different types of viruses. Viruses are put into set. Some are DNA, some are double-stranded, some are single-stranded. So they're not the same at all. COVID's the coronavirus family. It's not similar to polio in any sense. And polio likes to get around neurons and nervous system, where COVID does not. It likes to hang on to the respiratory. But there's one virus y'all should all be fair about. It's the virus that can cause cancer. That's HPV. So while we're talking about vaccines, the one vaccine that children should be getting their 2 doses because their immune system, Dr. Atusa explained how their immune system is more robust and why they should get it early at the 2 series versus waiting until they're adults, right? You could just say, oh, well, I don't need to worry about my child getting it. The reason why is because it's more effective to get it earlier, the 2 doses. And there are some, yes, versus as older, yes, then it can be in a series of 3. So it's shown to be better when you get it done at the time. And also because there can be chances, right, where HPV can be spread. So why not give that protection, right, to your children? And men and women both can get HPV. It likes squamous mucosa. So that's mouth, throat, that's anus, that's the men genitalia, the female genitalia, all the way up. So even if you have a hysterectomy, you can still get vaginal cancer. And I've seen that, and it's not pretty.
Interesting. I didn't realize that it was more effective as a kid. That's really good to know. Thank you.
Is. Yeah, that's why I really implore you guys. Like, I learn every time I talk to them, which is why I started a collective. I learned so much. First of all, someone in the chat's from Clubhouse. Hey to Clubhouse people. If you don't know about Clubhouse, you don't know. Um, but from Clubhouse, I met them, and I learned so much from them. So I curate and make sure the conversations are with somebody that, like, she's been doing it for 20 plus years, and she knows her stuff about viruses, about immunology, background, integrative medicine, all of it. So I really implore you guys to listen to some of those conversations. We spent, I think, on the podcast 2 hours on just immunizations, and she was explaining the history and going down the paper. And she's saying this from like personal experience, and mind you, she's an immunologist, so they know the backstory. She was explaining the backstory of how everything happened with them saying about autism and immunizations. Um, and then she's also talking about what people were describing in the chat. So I just hope you listen to that. There was something else. Hold on. Oh, you never got a shingles vaccine? Get it. It does have cognitive consequences. Yes, it does. It goes all the way through your body. She also said something. It's the biggest autoimmune trigger of all times. So as I wonder why there's a rising cancer rate in young people 30 to 40, and I'm seeing it. It may be this virus is a COVID. We know that. We know that HPV directly causes cancer, but there are viruses that also trigger other types of cancer, right? Some of the herpes viruses can cause certain types of cancers. We see those also related, right? Some related to HIV status. One of them is a Kaposi sarcoma. So there are viruses that do trigger cancer for sure.
Interesting. Yeah, I'd heard about like the increase of cancer in some countries was like from that delayed treatment for a lot of, like, it was like a colorectal study, a cancer study, where it was like because they weren't able to go in for like that year for like delayed care, it had like an increase in colorectal cancer.
So what happened was, in real time, a lot of us pathologists, we do the hospital work, but also a lot of it is surgery centers. And so everything that was, quote, called emergent care or emergency surgeries or non-emergent was put off. That included mastectomies, that included colectomies. So at the beginning of the pandemic, none of that stuff was done for a year. Then they got lost to follow-up. So I was seeing people with breast cancer that was diagnosed at the beginning, surgery put off, then life happened, and then they had metastatic breast cancer by the time they came back. Same thing with colon, because colon is one of the most preventable cancers through screening. And so we already changed the age too. So it was 50, and recently now it's become 45. So you've increased the screening age by 5 years. And I think that truly has something to do with it too, is we're screening more, but because of the delayed, it progressed. They also purported, because of the pandemic, that we're going to see a rise like by 30+% of cancer in the next 10, 20 years. So people are talking about their rights. This cost to healthcare from long COVID and cancer and all of the things that were neglected is going to affect us for decades to come. When we could have just sat home for a little bit and avoided this. I also think the diet exposure, and C19 are why younger people. So even if it was not the pandemic, there's some reason why now breast, gastric cancer, colon cancer are increasing in the 30 to 40-year-old population. So we got to figure that out. I would tell people, I'll be honest, after I saw a 30-year-old with colon cancer, I would tell people to see about Cologuard, to check your family history. I just did a conversation with Dina DNA. She is a genetic counselor. She's amazing. That podcast will come out on Monday, and she was talking about how you guys need to know if you should be getting genetic screening and counseling. And it's not just for cancer risks, for other diseases as well.
Cool.
Yeah.
Okay, Cologuard's a non-invasive colon cancer test that you can do at your home.
Yeah. Yep. It's a rectal. Cool. It's a stool test. Okay. We just get over it. It's a stool test. You check your stool. for a heme component. And here's the thing about it. It can be up to 88%. Now, these are for average risk people. If you have a loved one with colon cancer, if you have inflammatory bowel disease, you do not qualify for Cologuard. You should be going straight to the GI doctor. Do not pass go and get your colonoscopy. If you are low risk, meaning you don't have a family history or any of the risk factors that increase you, then you can start with Cologuard. My thought is, if you're younger than 40, I would say Cologuard. If you're 45, or if your mother or father had colon cancer at 45, you're supposed to get screened at 35. So 10 years earlier than the loved one that got diagnosed. You're not part of Cologuard. Cologuard should be for people that are trying, maybe just checking early, low risk, but I think your first baseline should be a colonoscopy, because there still is that 10 to 15% that can be missed with a Cologuard. So you get a Cologuard and it's negative. What if it's not? What if there's a polyp in there? What if you have microscopic colitis and you're worried about your bowel habits? What if you have a small tubular adenoma? So I always say start with the baseline.
Okay.
Yeah. And
Good
then
to know.
Cologuard, keep it in your back pocket. Nope, it's 45 for that. It's
Awesome.
45 for a colonoscopy. Someone put 40. Now mammograms are 40. Unless you're high risk, then it could be 30. But no, colonoscopies are 45, but speak to your physician for your risk. And yes, if you do have BRCA, that changes everything. If you have Lynch syndrome, that changes everything. So that's why I do say the genetic screening. And I learned a lot from her in that conversation, that we need to be looking at it differently too. You'd be surprised who fits the category. And she said there's a number you can call. I'll put that in the show notes. She said that you should ask your doctor. I hate that we have to say this, but you may have to ask your doctor, can I speak to a genetic counselor? Can I get genetic screening? Because the way she made it seem like it's not something that they're going to offer to you. And they haven't even offered it to me, I'm going to be honest. And I have two parents with cancer, a sibling with cancer, an aunt, uncle, like 75%. So, and I wasn't asked for it. I had to speak up for it.
Wow.
For genetic screening. Yeah. And every 5 years too. Your genes don't change, but every 5 years, new tests arise. So if you got it done and you have had cancer before, make sure you have to sometimes call and see, has anything been updated? Should I get tested again?
Awesome. Okay. Thank you for that information. I appreciate that. Thank you. I'm gonna have to do some of that myself. So thank you. I'm taking notes. So thank you.
Yeah, check out. I'll send you the link, but it's coming out on Monday. Like, I learned that was a good conversation. I learned a lot, and I really think this is the missing factor. I think it's part of our whole healthcare, and it doesn't get talked about a lot how important it is. Also, she said this, y'all. There are patient-initiated testing. There is the medical testing you get done through a genetic counselor, and then there's you guys going to 23andMe and stuff. That does not equate. It's not the same testing. It doesn't trigger the same things, and it's not FDA approved. So you can do patient-initiated, because patient-initiated still, I guess, will trigger where you end up talking to a genetic counselor. But the ideal way is to go through a genetic counselor. They ask you the questions, they screen you, and they do the guided testing at an approved laboratory.
Interesting.
Yeah. Don't go online Googling for it. Don't do a TikTok shop genetic test.
Interesting. I wonder, I wonder what the difference is. I mean, I'm sure it's like probably the same microarray, like genetic tests. I wonder what it would be different, unless they're doing like next generation sequencing. That's what I want.
Yes, they do. Yeah.
Oh,
So
they do?
So all of these things are different ways of looking at the genome. Like what you're talking about, next generation sequencing is a different way of looking at the genome. Somebody said it's costly. No, actually, she said that it can be as low as $250 for the basic screening and testing, by the way. Yep. For the genetic testing.
Interesting.
It can be that low. What you don't want to do is just get she also explained this in there. I'm gonna tell you, she was talking about the SNPs and stuff like that. She explained it in a way that makes sense the difference between the different going to 23andMe and what they're looking at, just a whole panel, right, and looking for things versus what these testing are doing, right?
Oh, that's good.
Yeah.
Yeah, because I mean, from like 23andMe is just like a microarray. So you're just gonna like be having pieces of DNA binded to one another at the bottom of a fluorescent plate, basically. But if they're actually doing next generation sequencing, then they're gonna have like mapped reads that they're gonna have that SNP detection at like way higher affinity. I would think at a way higher level. So I mean, that's what I would want. That's why I never have done the 23andMe and all that kind of stuff, because I know it's
That's
just
not,
it's not good
no.
stuff.
You want
Like,
medical, what this is called is medical grade, right? You're doing
yeah,
medical grade
yeah,
genetic
exactly.
testing.
Yeah,
Medical grade genetic
yeah,
testing will save
exactly.
your life. Also, there's familial hypercholesterolemia. I mean, there's a lot of things that you wouldn't know. If you wonder why all your family has high cholesterol, certain things, it could be in the family. Yeah.
Awesome. Well, thank
And
you
I
so
don't know
much.
about the cellular effects. I don't know, Rory. I think Rory's just, if you truly want to know, Rory, you're welcome to come when I do a live or, listen in to the podcast. But if you have a weakened immune system, then talk to your physician about that. That term is kind of vague. I don't know what that means. Do you have a immune deficiency? There's a common variable of immune deficiency.
Yeah.
Just saying a weak immune system. Actually, anyone that has comorbidities is the reason why you should get immunized. These are not live viruses, and basically you're priming yourself. And even if you have a weak system, it's even more why you need to be around people that are also immunized, right? It's the friendly effect, because you don't know who is going to get sick or have long-term complications. Bisnatch, this is his show.
No, it's like I love it. Thank you. Yeah, I appreciate you.
Oh, thyroid too. Yes, I forgot. Yes, there is a thyroid syndrome. MEN, MEN1, MEN2.
Awesome.
Okay, thank you.
Well, thank you, Keisha Davis. Hey, guys, Dr. Keisha Davis. If you're not following her, I don't understand why. If you're, she's a medical doctor doing awesome stuff, awesome outreach on TikTok and YouTube. A lot of her stuff, I follow her on YouTube, and her collective stuff is all there too. So, yeah, check it out, guys, for real. So thank you so much for your outreach and stuff, Dr. Davis, and thanks for being on here for so long. You at it for doing awesome work here, and yeah, thank you. I appreciate you.
You are so welcome. And today I just celebrated 1 year of my podcast, so it was funny.
Nice.
We were on Noom Vibe laughing, Dr. Sharon and I, about it. All the sometimes the audio, the lighting. I'm like, oh my God, what was I thinking? It's funny looking back at yourself
I
throughout it.
know.
But thank
Yeah,
you so
I
much.
started in like 2021 on YouTube, and I have some of those videos too, and it is so bad. It's so funny, and it's like the
What was I
equipment.
thinking?
Yeah,
Ooh, the
it's so.
sound. My
It's
friend, she was like, I don't need a microphone. So she
uh,
listened to herself and she's like, why do I sound like I have a speech? I was like, I told you to buy a microphone.
So true. It's so true. Well, Dr. Davis, thank you so much for coming up. I hope to talk to you soon and have you up soon. Okay? Anytime. You're welcome. All right. Have a good one. Bye. Gosh, guys, again, for real, Dr. Keisha Davis, if you're not following her, she's a pathologist doing amazing science communication on TikTok and YouTube. Follow her both places. It's a medical collective on YouTube, and she has all the links in her profile. Check her out, guys, for real. It's awesome. It's awesome. There are good sources of information on this app. She's definitely one of them. All right, guys. Well, I have not done the thing for you guys. Yeah, thank you, Dr. Davis, for real. Thank you. Ducray's gonna get mad at me. I know your time. This is your time. Wait, what? I didn't do the thing. Oh my gosh, I was about doing the thing. Oh my gosh, guys. Wait a second. Oh gosh, guys, what's happening? What's happening? Here it is. This is it. This is me. What's up? Hello. Hello. Thank you so much. The last subscriber, my sickle cell might be the last subscriber ever because I don't know what's happening with subscribers now, guys. I don't know what's happening. Cousin Blue, Renee, Ducray, Uncle Hippie, Nikki, Marshmallow, Stars, Ado. Thank you so much. Thank you for the likes. AMDZ, Mrs. Dr. G, Marshmallow, Uncle Hippie, Ado, Cindy Rose, Darcher Man, Ducray. Thank you so much. Thank you guys so much. Super chats, $5 if you want to. That's where you can actually hang out and have a question asked, or I can review your article or whatever you want. Check out my YouTube, has a highlights reel of all the cool stuff that's happening. It's round. It's round. From here, it's round. I can see that it's round. It's true. And also, all right, phew, coming back to Earth. I'm back. Welcome back. Guys, I don't know. Okay, so, oh shoot. I'm back. I'm sorry. Thank you. Guys, the subscribers, I guess we got rid of the subscribers now, so now we're just a super fan. So lives are do super fans, and then subscribers are for like people that do the normal TikTok stuff. Me and you right here, we're doing like this live show every night thing. So this is like a super fan stuff. So if you want to do the super fan thing to get all the stickers, to get all the cool stuff, there's some like cool stickers that everyone like posts in there, and it like puts this huge icon on the screen, and then you can like see that's some cool stuff that you can get. So like I'm sure there's like gonna be a super fan that just spams this thing. Maybe like me in my like king thing. Oh, there it is. There's me. That's a weird one. That's something that's weird. Anyway. Oh, there's another one. See how they pop up? So that's like you can be a super fan to do that thing. Oh, that's that's me. Okay, so that's me face swapped on RFK. That's actually, and that's me face swapped on TR, and there's the RFK one again. So there's that's a weird one. I don't know. It was funnier before he was the head of HHS. That was before. I know. Yeah. Oh, there it is. There's the RFK one again. Okay, guys. Okay. All right. There's too many. Oh, políticamente. Qué bueno. Gracias, mi amigo. Yeah, look at you guys. Oh, there's my game face. That's the game face. That's the game face one. Thank you guys. Thank you. I love it. Thank you. Also, oh, that's me as a king. That happens. I did my I won a fantasy football league, and I did some like Sears photos with the belt. You know what I mean? I made myself a belt as a fantasy football champion. So I went and did some Sears photo. Oh, that's a negative COVID test. Renee. That's a negative COVID test. Everyone remembers those. Everyone knows. No, I don't. No, and I don't do any hair supplements, dyes, Mindoxaville, whatever. Nothing. All natural. Oh. This is cool. All right. Oh, it's okay, Uncle Hippie. It's all good, bro. I had like the $6 subscription and then like a $15 one. And then but I don't know how much is the super fan thing. When did the counter start? This started like a week and a half ago now. So I think it's Oh, is it $10? A super fan is always. Oh my gosh, every single one is $10? Wow. That's crazy. because I can set my own tier, dude. What? I wonder how much that is, because at least the subs were like 50% of that. I wonder what the super fan cost is. I wonder if how much, because I wonder if it's $5 then. I don't know, guys. That's wild. That's wild. If you weren't aware, yeah, TikTok takes all of the like 50% of all the gift money. So if you gift $10, I get $5 basically. It's okay, Uncle Hippie. Nobody is required to gift anything. You know what I mean? You guys, the subs we do, like, it's if you actually wanted to donate, if you ever wanted to donate, you know, for whatever reason, then the Venmo is like 17 cents for every $5. So just letting you guys know. But yeah, please don't ever feel like you have to give money or anything to be here, or you're totally fine. At the Discord and stuff, we have a subscriber only Discord chat. But I mean, it's pretty much the same thing. The money part, the real good part of the Discord is all the show notes and all the studies and stuff, and that's all free. No. The Venmo only takes 17 cents out of the $5, as opposed to 50% of it like TikTok. So, what's the other thing? Snapchat for $5? Oh, that's the super chats. So it's like basically Venmoing me for $5, and then you can put in the tagline like a question, or I've had people send me an article that I can like I'll go over and we can review. Yeah. Oh, thank you, Marshmallow. Thank you for that. I appreciate you. Thank you. Oh yeah, Charity, don't worry about it. Yeah, all good. Yeah, all good. All right. Alrighty. This is gonna be a fun one, guys. This is gonna be cool. They are super chats are like technically on YouTube. Yeah. They're like, which I technically am, like, I'm streaming on YouTube as well, but I don't even have a subscription set up there because I'm not even monetized. So, Marissa, we're gonna go. I got up my science article. We're gonna learn about mosquitoes and dengue virus and Wolbachia. What is that? I don't even know. So we're gonna like figure that out. I don't even know. I'm learning. Okay, Bug, you're good. Yeah. None of you guys are ever. That's all good. I did this for free for over a year. No money. You know what I mean? Like I'm not here for the money. It is nice. I'm not gonna say nothing. You know what I mean? But it's all good, guys. What about limes? What about lemons? Okay, that was good. I don't care who you are. That's funny. I don't care who you are. That's a good one. That's a good one. Okay. Oh, dude, Cray. Stop, dude. That was funny. Thank you, Charity. Thank you. Oh my gosh. Thank you, Marshmallow. Thank you. Wait, guys. Wait. We'll do it. Do I have to? I think I can do it. Okay, this. Okay, one second. We gotta have a dad joke button. 1 second, guys. It'll be funny. I'm sorry. This is awful. This is really good. This is really good TV, guys. This is really good. All right. Lines. What about lemons? Oh, what? Womp womp? You would do a womp womp? You do this? Lines, what about lemons? Oh, come on, dude. No way. There's no way I'm setting myself up for that one, dude. Oh, you know what? Oh my gosh. You guys. All right. You know what, dude? You know what? You guys. One second, guys. 1 second. Stop. Okay, here we go. Nice. We're setting it up. We're all setting it up. Dude, the production value. Nobody's got this production value. You know what I mean? Nobody's got this. I got a stream deck all set up. I'm locked in. I'm practicing on my own. You know, this is the Colbert Report. You know what I mean? This is the science, sign. It's okay. All right. Okay. I like that. There's a lot of little funny. Ooh, what's this one? What's awkward? Sign rapport. That one's named awkward. Okay. Oh man. Okay. What are you talking about? Dude, all my jokes land all the time. Stop. Okay. All right. I can't set myself up for this. Okay. All right. Okay, guys. We're going back to it. There's a sinky unique. Oh, interesting. I didn't know about that, Marissa. Thanks, Joe. Thank you. You're not old enough for dad jokes? Do you know what we do here? I'm not old enough. Thank you. You know what, Yestertech? You're allowed to be here. You know what? We'll allow you. You're good people. I appreciate you. See that? See what I'm talking about, guys? I want you to follow Yestertech's lead. You know what I mean? The neurons in my fingers are dying. Yeah, I wouldn't. Guys, I have an RSI injury in my thumb. You know what I mean? Do not. The likes are nice, but if you're gonna don't tap yourself numb. You know what I mean? Take breaks. That's like, you don't need to do that at all. Or even watch. You know, you can watch the the YouTube stream. You know, hang out, chill. I appreciate the taps though. I do. I'm planning to retire at 100, most of the way there. All right. Yeah. Oh, AMDZ. All right. Okay. All right. Just be safe. Okay. Just be safe. Okay. I'm sorry. We're getting to it. We're getting to it. Exactly. Okay. All right, guys. We're doing it. Here we go. We're going back. What? I didn't. Wait. Oh my gosh, guys. This is not supposed to be it. I am so. Oh, this is awkward. Sorry. No, I was supposed to have. This isn't the effect that I was supposed to have. Dude, who is doing this? This is so bad. This is supposed to be the mad scientist guy. And then yeah, 1 second, guys. Yes, we're back. The peer review, all the cool things that are happening in science that nobody talks about except for here, right now. The peer review. Yes, thank you guys. Thank you for being here. I appreciate you. Okay. How billions of hacked mosquitoes and a vaccine could beat the deadly dengue virus. So I think Gene Drive is the thing that they use in order to try to they try to recombine. They actually use CRISPR and like two mated mosquitoes mated together could actually like kill off the ability for it to mate. So I'm curious, is this like an actually different type of gene drive, or is this a new technology? And I'm curious about Wolbachia. I don't know what Wolbachia is, a bacterium, what that is. So we'll have to learn about that. So we got a lot of learning to do. Isn't that awesome? Last month, a parade of vehicles wound its way through the 3 cities of Brazil, releasing clouds of mosquitoes into the air. What? The insects will carry a secret weapon, a bacterium called Wolbachia that lowers the odds that the mosquitoes can transmit the dreaded dengue virus to humans. Oh my gosh, we have to learn about Wolbachia. We got to learn about dengue virus. We have lots of learning to do. Wolbachia is a genus of... Okay, Wolbachia is a genus of gram-negative bacteria infecting many species of arthropods. Okay, guys, don't... How is this going to work? How's this going to work with this? Yes. That works. Okay. Wolbachia is it infects many species of arthropods and nematodes. The symbiotic relationship ranges from parasitism to obligate mutualism. It is one of the most common parasitic microbes of arthropods and is possibly the most widespread reproductive parasite bacterium in the biosphere. Wow. Its interactions with hosts are complex and highly diverse across different host species. Some host species cannot reproduce or even survive with Wolbachia colonization. So that's it. So that's what that is. That's cool. One study concluded that more than 16% of neotropical insect species carry the bacteria of this genus, and as many as 25 to 70% of all insect species are estimated to be potential hosts. Wow, that's incredible. Okay, so that's what Wolbachia is. And then the dengue virus. The dengue virus is the cause of dengue fever. It is a mosquito-borne, singles-positive stranded RNA virus of the family Flaviridae, genus Orthoflavirus. 4 serotypes of the virus have been found, and a reported 5th has yet to be confirmed, all of which can cause the full spectrum of disease. Nevertheless, the mainstream scientific community's understanding of dengue virus may be simplistic as, rather than distinctive antigenic groups, a continuum appear to exist. The same study identified 47 strains of dengue virus. Whoa! Additionally, co-infections with and lack of rapid tests for the Zika virus complicate matters in real-world infections. Dengue virus has increased dramatically within the last 20 years, becoming one of the worst mosquito-borne human pathogens that tropical countries have to deal with. Estimates published in 2013 indicate that as many as 390 million infections occur each year, and many dengue infections are increasingly understood to be asymptomatic or subclinical. Wow. Incredible. Dang. Wow. That's not good. Wow. So it's rapidly, so that makes sense. That makes sense why they're trying to use this. So now we understand, wow, this Wolbachia is going to have them prevent them from having kiddo mosquitoes. Mosquitoes. Stop. That's funny. Stop. That was funny. That was good. Mosquitoes? No. You guys are sometimes. I'm all by myself. Here. Stop. That was funny, Renee. That was funny. That definitely was a fail. Dude, stop. Okay, now I got the dad jokes in my head and I can't get it out. See, you guys caused this problem. Okay, these infected mosquitoes are the latest weapon in Brazil's fight against dengue, which infects millions of people in the country each year and can be fatal. A biofactory that opened in the town of Curitiba in July can produce 100 million mosquitoes eggs per week. Oh my gosh. Making it the largest such facility in the world. 100 million mosquito eggs per week. Oh my gosh. The company that runs it, Polbito do Brazil, aims to protect about 14 million Brazilians per year through its Wolbachia-infected mosquitoes. That will come as welcome news for the Brazilian health officials battling the rapidly growing threat of dengue. In 2024, the country expected its worst outbreak yet, with 6.6 million probable cases and more than 6,300 related deaths. This year's outbreak, although less severe, is one of the highest on record, with 1.6 million probable cases so far. And the problem is spreading. Argentina, Colombia, Peru all experienced record-breaking outbreaks in 2024 and have been sustained increases in cases in recent years. Across Latin America and the Caribbean, deaths from dengue last year totaled more than 8,400, and the global figure reached more than 12,000, the highest ever recorded in the disease. Wow! So then there's a bar chart. It's talking about number of cases per year, and it's just like steadily increasing from the early 2000s to 2025 here. And there's a huge outbreak in 2024. What in the world? It averages from like 1.5 to 6.5 million. Oh, there you go. Ado likes the dad joke. See, guys. That's great. Like, what happened to bring it from 1.5 million to 6.5 of dengue? What could possibly explain that? It's 4x. As outbreaks grow larger and the crisis becomes more urgent, the Wolbachia method isn't Brazil's only bet. A locally produced dengue vaccine is now awaiting approval by the country's drug regulatory agency, and its health ministry expects to start administering tens of millions of doses next year. These twin advances offer some hope to the other countries in the region and beyond. Driven by forces such as climate change, mosquito adaptation, globalized trade, and movements of people, dengue is becoming a crisis worldwide, with an estimated 3.9 billion people at risk of infection. Yowzas. That's a lot. That is so many people. 3.9 billion, guys. As Brazil rolls out its armies of infected mosquitoes and a vaccine in the coming years, the rest of the world is watching closely. Oh my gosh. The first infection isn't necessarily always the bad one. It's the second one. Interesting. I can help. I learned so much about it from the doctors here. Oh, cool. Well, thank you for helping. Wow. That is wild. Why did it increase so much that year? What are some possible hypotheses for that? I mean, the climate change, that's what they were talking about. Oh my gosh. These mosquito eggs are so gross. There's a 50 mil conical, and it's just like tons of them. Oh man. Ugh. Huh. Interesting, Marissa. Oh, maybe the deforestation? I wonder if the deforestation is decreasing the amount of biological control. Yeah, exactly. Because they're I thought that they were like clear cutting a lot of the Amazon that they hadn't before, and they're disrupting that and making it into farms, and maybe the farms have stagnant water in them. Because normally there's like biological control agents, right? There's going to be mosquito, basically predators, right, that are eating them, and that's what I would assume. That's my hypothesis. It's untested. I have no idea. Oh. The local approach. Currently, there is one main dengue vaccine in use around the world, Qdenga, licensed by the Japanese pharmaceutical company Takeda. The vaccine has been approved in many companies. What kind of vaccine is it? Let's see, guys. We're learning. We're on a learning journey. At 100 million eggs per week, it would take over 100,000 years to equal mosquitoes on Earth. Wow. Oh, it's a live attenuated vaccine made by Takeda Pharmaceuticals that protects against all 4 dengue virus serotypes. It is administered in 2 doses, 3 months apart, and it's approved for individuals aged 4 and older. It uses the DENV2 virus as the genetic backbone. And it as the base to express the 4 surface proteins of all the 4 serotypes. DENV1, 2, 3, 4. Interesting. Interesting. It's crazy that it has a live attenuated, but then it has all 4 of them in there. That's pretty cool. Dang, that's cool. Kedenga's rollout in Brazil is limited. The country bought 9 million doses of the 2-dose vaccine this year, enough to vaccinate 4.5 million of its population of more than 210 million. Guys, that is not enough. So far, Kedenga has been administered to children between the ages of 10 to 14, one of the groups most likely to end up in hospital after contracting dengue, together with old people. Its safety and efficacy has not been tested in adults aged over 60. The main reasons for such a limited rollout in Brazil are availability and cost. Even though Brazil secured Kedenga and other from Takeda in one of its cheapest prices in the world, around $19 per dose. That's not enough. That's not a lot. The cost is still high compared to other vaccines, and it's one of the most optimistic scenarios. The maximum number of doses Takeda could provide by 2028 is 50 million, enough to vaccinate only 25 million. That's like 10%, guys. That's more. What's more, the people who have not had dengue before clinical trials did not show that Kedenga to be effective against all 4 variants or serotypes of the virus. Oh no, guys. The CDC is dead. You guys roll out nothing but lies. Huh? Wait, what are you talking about? The CDC is you. Oh, hey, what's up? Sickle cell 5 minute. How's it going? You are the CDC, brother. RFK is the CDC, bro. What are you talking about? Brazil is trying to address all of those limitations with its 1-dose vaccine candidate developed by the Butantan Institute, a public biomedical research center in Sao Paulo. Quote, having local production capacity gives us independence on decisions, how many doses we need, and at split speed to vaccinate. Why aren't they using mRNA technology? You can practice, you can create prices that are much more suitable and absorbable by the public health system such as Brazil. Buchanan is also optimistic that its vaccine will be effective against all 4 forms of the dengue. Severe disease usually occurs when a person is infected by a different serotype to their first infection. That means that a successful vaccine needs to generate antibodies for all 4 serotypes without triggering severe reactions. That's what you're talking about, Marissa, which makes it difficult for the vaccine to develop. It was indeed a challenge as each serotype behaves differently, says Nueza, a manager of the viral vaccine development laboratory in Buchanan. The vaccine's development began at the U.S. National Institute of Health in the late 1990s. That's us, guys. That's us. Where scientists transformed dengue viruses that had isolated from patients its weakened vaccine strains that could trigger the production of protective antibodies without causing disease. In 2009, Buchanan extended that research by working to solve the challenges of combining the 4 strains into one vaccine. After testing 30 formulations, Buchanan arrived at one that would provide that proved highly effective in preventing infections, according to the preliminary results of the phase 3 trial involving more than 16,000 volunteers in Brazil. The study reported that 2 years after vaccination, the formula was 89% effective in preventing infections of people who had previously been infected with dengue and 74% with no previous exposure. That's what you were saying, Marissa. That's crazy. Oh, thank you. Yeah. There is no filter, 5 minute. What do you mean? Wow, you Joe, past that you just didn't, and that you didn't, the CDC is dead, they lie. Oh, okay. You got me. You address what I just said, the CDC is dead, comment on that. Okay. You're right. It's nice to know that these mega trolls wouldn't still be yammering this much if they were winning. Yeah, that's true. A lot of the dengue related mortality in the area I was in while I was there. Oh. Is it in the northern US? Or dengue? I don't know. That's a good question. At least the research money is coming from us, the NIH. That was your answer to my question, really? I don't even understand what your question was. Love all people and animals. I don't even know what you're talking about, dude. It was a well-designed trial, said Smith, who was a team lead for the vaccine development in the WHO. But she said one limitation of the trial is that it was conducted in a single country and therefore runs a risk that all 4 serotypes were not circulating at that time. In fact, serotypes 3 and 4 were not prevalent during the data collection period of this clinical trial, although they are now circulating in Brazil. Buchanan researchers suggest that the vaccine will be effective against serotypes 3 and 4, pointing to data from a phase 2 trial in 300 adults that showed participants producing neutralizing antibodies to each of those serotypes. That study evaluated safety and immunological response in the short term rather than looking at the vaccine's long-term safety and preventing infections. The full results of the Brazilian phase 3 trial, which will provide data of long-term effectiveness, are not yet public and are undergoing peer review. The vaccine is already moving through the country's regulatory process, and although there's no certainty about the when Anvisa, Brazil's regulatory agency, will approve the vaccine, the government is counting on it. In February, the president of Brazil announced that starting in 2026, the Ministry of Health will be buying 60 million doses annually. Still not a lot, man. The CDC is dead. Well, no, obviously it's not. RFK, you are the CDC, right? RFK is the head of the CDC. So what are you talking about? The CDC is in like the terms of like the scientists that were there. They all got gutted. Yeah, sure. Did you read the paper on how HIV transportation was studied, copied to make vaccines? No, I'm a little scared of that. I don't know. Easier to deliver throughout the body. No. They just knocked out the CDC. What do you say about that? Well, I mean, what are you talking about? They are not going to CDC out our government. Yeah, I mean, that'd be awful. That's awful. Why would you want less scientists to be at the CDC? I mean, I think it's awful. I think it's gross. I mean, they're obviously not talking about, putting competent people in at the CDC, and I think that they're politicizing the CDC, which is awful. I don't agree with it. Yeah, I mean, if you're talking about like less scientists involved in the CDC, then I disagree. RFK doesn't want scientists; he just wants a bunch of yes men and people that are just gonna repeat his talking points. I think it's awful. To meet the demand, Buchanan is now producing the vaccine at its Sao Paulo facility. On its lush campus, an entire building is dedicated to churning out dosage. Regarding the vaccine's approval, we are very confident, says Collis. We also anticipate there's a very prominent need to have this product in the arms of people, so we hit the road running and start producing vaccines last year. Although Butantan's product effort will focus initially on meeting Brazil's need for millions of dosage, Collis expects that the vaccine could reach other countries. Butantan had been discussing that with its development partner, the pharmaceutical giant Merck. Hey, that's who made ivermectin, guys. The Pan American Health Organization, PAHO, on how to make the vaccines accessible to other countries. The logical first step, he says, would for it to be roll out through PAHO to Latin America and Caribbean and other nations. In the meantime, Merck is developing a potential vaccine for Asia with an almost identical formulation, which builds on the knowledge that Butantan has developed. In a statement, the drug firm said that Butantan is, quote, sharing its clinical data and other learnings. In June, Merck started enrolling participants in its own phase 3 trial. That's crazy. That's wild, guys. Oh, surely the new CDC will be definitely doing well to stop us from having any like that having in the future, right? Any problem like that would. Yay. The CDC isn't gone. It's just dog trim. Doshim and fired the experts and hired Lola. It's exactly because I'm blue. Exactly, yeah. Well, you just skip over the real important stuff, don't you? Well, let me know what's the important stuff. What are you talking about? I have no idea what you mean. What is this vaccine that you're reading about? I saw Ebola is on the rise, the dangerous strain. No, Alice, we're talking about the dengue vaccine that Brazil is developing in order to combat their crazy high outbreaks that they're having. They are not going to CDC out our government. Okay. You're just repeating the same 5 things, love. Yep, they're dead. There is no more CDC. Okay, you're just kind of just repeating the same things over and over again. I don't think that you're actually a real person. I think you're a bot. Yeah, you're like repeating the same like 5 things. So no. You're paid to lie, uninformed, as viruses don't exist. Yes, Ellie. Thank you. Thank you. Yeah. You're paid to lie or uninformed. It's so, I love when they come in and they actually, I'm like, but they don't, guys, they're not anti-vax. They don't think that viruses are real. And then people come in and they like prove my point. It's amazing. No, I mean, I don't think that they're bots. I think they're misinformed. You know, like genuinely. I don't think that. I think a lot of them repeat Russian disinformation. You know, but they are misinformed themselves. You know what I mean? Okay, that was it. The peer review. Yes. All the cool things that were happening in science that nobody talks about except for here. We do it. We do it right here. Dude, nobody's talking about. Who's talking about Wolbachia? Huh? And dengue? Huh? Where do you get that? Nobody. All right. Dude, I love a good science news article. I was thinking about doing Science Mag. Like science. Oh, wow. They got the science.org URL. When did that happen? Sciencemag.org changed to science.org. When did that happen? Wow. Cool. Yo. Yes, I agree, Dan. I agree. Yeah, the Russians are conquering America. It's so easy to like disseminate these ideas and they take over. No reason for sickness is not viruses, a weakened immune system because of toxins. For sure, Ellie. You know what? You made me change my mind. You know what? She made a really good point, guys. Guys, we should stop. We should listen to her. Oh no. Okay. Well, guys, you know what? We did the science news. We did the ads. Thank you. Exactly. Thank you for that scientific publication. That was really, really informative. Thank you. All right. I think Hi, Toy Ting. Are you a bot? And you're literally like the nothing was like from. Why is President Trump not using the full power of the U.S. military to go after the left? Because he knows that they're not a threat. That's it. That's the answer, dude. That's the real answer. That's the real one. That's the real one. Well, guys. Hi. Hey, Tanya. Am I a conservative? Well, I mean, it's conservative to conserve the environment, you know? So, you know, I'm kind of like a Lincoln Republican myself, you know? Really big into, we're all Republicans here. Stop, Marissa. Stop. We're into Theodore Roosevelt, like how he conserved the environment, and we, you know, broke those monopolies and trust busted, you know? Big fans of that here. Big fans of Lincoln. We need conservation, yeah. We need the U.S. military here on this side of the Atlantic to deal with the left. Are you talking about in the UK? Why would we have the U.S. military deployed in Ireland? Of you trust government, silly, eye roll equals blind, open your eyes. No, you're mega, MAGA, big pharma, remember? Oh, yeah. Oh, my gosh. Marissa, thank you. Mega MAGA. Where are mega MAGA? Exactly. We're mega pharma. Big pharma? No. Mega pharma. Exactly right. Marissa gets it. Just that it, but that isn't Republican. That is a very liberal stance. Jessica's on to us, guys. Micropharma. Oh my. Nanopharma, dude. Everyone's on that micropharma stuff, but that nanopharma, dude. That nanopharma. Nobody's on that yet. Nobody's on that. Nuh-uh. That nanopharma. That peptopharma. Nobody's at that level yet. Martial law is the only way to deal with the left. Okay. That's a little psychotic, but okay. For sure. If you want to know who runs this beach, the NRA. I don't know the politics. We don't vote for politicians that actually want to do gun control. It really is that easy, I think. I think it's just that we don't have the political will in order to do it. You know, they just don't have the political will in order to pass it. So it really, I don't know if the NRA is really that big of a eco pharma. Yeah, I don't know. I don't think that the NRA really has that big of a. I don't think they're donating that much money to actually buy people off. That's what I'm trying to say. You know, I'm sure they're donating to people, but it's not like you're not buying them off with like what could they possibly be donating? $1 million to each person, you know, a year? I don't think that's enough money. Rothschild, poisoned educational system, and more. Ellie, why does your all your messages sound like it's like a Breitbart title? Like it's incredible. I don't understand how. Sadly, I think politicians, some, not all, are corrupt. Yeah, for sure. I agree. But like, I think that the real truth sayer is like, the real truth is that politicians are more of a mirror than anything, and we elect those people, and that's the problem. So. Uncle Hippie, I don't know if I stumbled into a conservative Trump humper talk or not. I'm confused. Jessica, you're at home. You're at home. We like to have fun. We joke around. So we're all good. How would gun control laws keep guns out of the hands of criminals? Just by making it harder to get them. You know, it just makes them harder to get. That the vast amount of gun crimes are just committed by people that legally owned and operated guns, like that bought them. So like school shootings is what I really care about, and a lot of those are just legally owned and operated. You know, they before that. So it's not like a. You know, so just making them harder to get is restricting access just a little bit is easier and good. I'm recruiting ICE agents, signing bonus $50K. Aren't they? It's like $300K or something. ICE has become a jobs program for Republicans. It's gross. Marissa, the NRA does lobby a lot to prevent legislation. I'm just curious about like the amount of money that they're actually donating to politicians. I can't imagine that it's actually that much money. They probably don't have that much money. You know what I mean? They pick the incumbents. I mean, the incumbents are already chosen, right? Yes, proudly, millions as you are not awakened. Okay, QAnon. That's him. Exactly, because I'm blue. Exactly. They're the number one killer of our time. What about our time? What about your time? But what about what time? Oh, wait, they don't have unlimited money. The NRA doesn't have unlimited money. At least restrict guns that are battlefield. An air rifle is one thing. Yeah, Alice, I agree. Like AR-15s stuff should be illegal. It's a assault weapon ban. Sorry, because I'm blue. Which part? That's all good. Yeah, I would. Disagreement is totally fine. I don't want everyone to believe what I think. Yeah, I agree. People do need training. Wow, that's it? $2 million? That's it? How much does NRA spend on lobbying? Open secrets. National Rifle Association. Total expenditures in 2025, $1 million. The most that they spent probably was like Sandy Hook and stuff. That was $5 million in 2021. That's crazy, dude. That's like nothing. 5 million, guys. That's nothing. In 2024, they spent $2 million total. That is nothing. Yeah. Why can't we do away with lobbying? It's the worst for the public. I mean, it's tough, Jessica. I mean, like, wouldn't you want people lobbying for causes that you cared about? If lobbying is just people that are going to congressional offices and, you know, getting an ear to Congress people, then I want people lobbying on behalf of the issues that I care about, right? But I think what people actually care about when people say that is undue influence, right? They don't want people buying like votes from money that are spent, and that's what I think people were actually talking about. And that I don't know if they're actually being bought out for $2 million for all the all the Congress people. I mean, what are they doing? $50,000, $100,000? You know, I don't know if you could change someone's vote. I think they're just going to pro gun people already, and they're just like they're greasing it a little bit. I don't know if they're actually like no more super PACs. I think super PACs that's old. People don't use super PACs anymore because they don't care about dark money. Like billionaires don't care about it anymore. They're just spending money directly. Super PACs is how it was done before when the corruption was dark money. But now the billionaires just buy Trump coin. Now billionaires just give Trump $100 million because they shut the company down for in a lawsuit. So they don't need super PAC money. They just give Trump the money, right in and of itself. Like Elon Musk didn't create a super PAC in order to spend $300 million to win him the election. He just he made an LLC and just spent that money. They don't care. Like the billionaires don't care about dark money anymore. They don't want to be transparent. They don't want to be they don't care about being transparent. Maybe millions give money to Pfizer to make up stuff. Even if that did, Politicamente, even if that did, all the scientists in the entire world are also testing those things too. So you'd have to not just give money to Pfizer, but you'd have to give it to all these other organizations that are all testing Pfizer's products. So that's what it is. Also, they can probably give money, non-money gifts. I don't know, Renee. Yeah, I mean, but it's probably through. You're right, and that happens like with the Supreme Court, right? With Clarence Thomas getting a bunch of gifts and houses and all that kind of stuff. Like for sure, they're greasing the wheel for sure that way. Yeah. You mean social issue lobbyists? I mean just like in general, just like all different types of lobbying in general. Yeah, exactly, Kathleen. It's now it's blatant. They don't need to like Trump coin is like open. You know what I mean? You just pay them. How do we shift the political spectrum when money overrides the public opinion? That's a really good question, Jessica. I don't know. You got to like start locally and start small. That's like the only way. I do think that like our votes and stuff do matter, but when we have a Democratic Party that like, you know, we have young people that don't think that their vote that matters anymore, and that's the problem. I think that's the big problem. The left just isn't organized. Democrats aren't organized. Citizens United is a big issue. Corporations shouldn't be allowed to fund campaigns. Marissa, my point is that like Citizens United doesn't matter anymore because Citizens United was just the creation and expansion of super PACs, and I don't think that super PACs make that big of a difference anymore. I think that you can just make LLCs and be open with your corruption. Like 15 years ago, it made a big difference when they were all trying to play the dark money game, but nobody cares about dark money anymore. You're just open with the corruption. This is one of Plato's largest criticisms of democracy. Interesting. I know the Plato versus Aristotle arguments of democracy are really interesting. It is an interesting thing that we are circling, it seems. When did you change from Democrat to Republican? I mean, we're all Republicans here. You know, this is all big Republican, the biggest Republican stream on TikTok. I hope so, because I'm blue. I mean, the whole idea is like we have to be able to unite around whoever we elect, and that's the biggest problem, is that too many people on the Democratic side, on the left, are like, you do this or else I'm not going to vote for you. And that doesn't happen on the right. They always come together and they always vote like Trump no matter what. And there's no cohesion on that, because the Democrats don't care about winning. In the Democrats, a lot of people on the, especially the hard leftists, which I would, my people, you know what I mean? I'm self critiquing here. A lot of them will say, I'm glad you didn't win, because you know what? If you didn't win, then you're going to have to come to me and you're going to have to ask me for my vote next time. And you're going to have to bend to my will when you don't win your election. And that's not how politics works. You have to win the election. And then once you win the election, then you cross that finish line and you pass that legislation that you can get with everyone that crossed that finish line. And that's the problem. Exactly, Mr. Unemployed. It's just a one-party rule. It's a one-party. We're all Lincoln Republicans here. It's all good. It's conservative to conserve the environment. So there you go. I want to trust bus just like TR did. All that kind of stuff. It's because the old ones want to keep legacy intact and the new ones are to fight it, and it's causing. Yeah. I mean, I think Pelosi is an effective leader, though. She was really good at keeping the House whipped and kept them in line. I mean, that's the problem. We need another Pelosi, not less of her. Why has the left never implemented police reform or gun control when in power? I mean, they did, Carl. The Biden did pass one of the biggest gun control measures that they could. It was huge. Police reform happens at the local level anyway, so it's not like a national bill. So Pelosi doesn't. I mean, what Pelosi made money on? What, Nvidia? Like, give me a break, dude. The whole insider trading thing is completely overblown. This new young generation has been mostly right instead of progressive. Exactly, Tina. Exactly. Especially guys. Guys are like 30% more Republican than women. It's awful. There's like a 30-point gap now between men and women that are 18 and 24. It's awful. The framers had guarded thoughts about our government too. Similar concern for oligarchy even then. Yeah. That was the whole idea with the Electoral College, to prevent something like this that's happened. I mean, so much of our government and our Constitution was to prevent this from happening, and you just we're barreling through all the safeguards that happened. Booker is tied with the little hat people. I don't know what that means. Can the left combat the gerrymandering so that the election districts are fair? The problem with, if they continue down this road, Jessica, like basically the right, the Republicans have more states that only require legislative approval. If they go down this road, they're gonna be even more on the side. It's really bad. It could be really bad. It could swing the House towards Republicans for decades. If all the Republican governors all act in unison to gerrymander all of their states, they could be decades of a Republican House. Thank you, lady. I agree, Tina. They destroyed the checks and balances with the monopolization of the House and the Senate and the Electoral College and the president. It's awful. And the Supreme Court. the Republicans have a structural advantage in every single aspect of the government right now. Cory Booker and the Jewish lobby. Oh, I don't think AIPAC is that big of an impact on our politics. I think that's another one where people totally oversay how much AIPAC has a impact. Would one man vote not be better and more fair? Yeah, for sure. I mean, yeah, Alice. I mean, for sure. We can't play nice or fair with them anymore. Renee, I think that people need to actually get involved and actually vote for sure. And H1B, no, they're fine. Those are fine. Resist. Those are totally fine. You actually want people coming over from H1Bs because they stay. They have kids here. They're learned. They're scientists. They're high education and attainment, and they create a bigger technology economy that we need. Absolute deflating of my little balloon of personal hope that Democrats can pull this shit. Yeah, I mean, we need to do better. They power grab because we counted on them to be moral. Yeah, Renee, exactly. I'm a doctor in microbiology. I'm a scientist doctor. I just get to be dictator instead. I mean, that's what everyone wants, Joe. Everyone just wants a dictator. Nobody really cares about the Constitution anymore. And the question is will the Democrats play by the 1787 Constitution, or will they play by the 2025 Constitution? So I think that you have to play by the Constitution that we have now. I think it's, yeah. Do you really need more nerds? I'd say let's import more jockos. Okay. The problem with pure democracy is the majority still decides for the minority, not always good. Yeah, that's called the tyranny of the majority, Marissa. I totally agree. Yeah, I mean, that's the whole idea of the Senate and the Supreme Court, was to try to prevent that from happening. But tyranny of the majority is real. It happens. We want our nuclear family system back. I mean, you already have it. There's no problem with drag queen or trans people unemployed. I'm hugely for vaccines, Crystallian, for sure. These are all the vaccines we've gotten as a community because vaccines save lives. 5 million lives saved every year. Every vaccination is $1 spent and $11 saved. So absolutely. Makes sense. Yeah. Daisy, over 30 different diseases are pushed down and controlled because of vaccines. Absolutely huge. Cool. Medical microbiology in college. That's awesome, lady. Nice. Debs, I studied biology. Nice. Please go to Russia and North Korea. Exciting. Do they not have more side effects? What has more side effects, do you think? Measles or the MMR vaccine? Yeah. Definitely the measles. Measles is the vaccines have less side effects than the viruses themselves. No, that's not true, Debs. That's not true. Nope. Peach Lane. Nope. It's not true. Yeah. Yep. The viruses and the pathogens have way more side effects than any of the viruses and than the vaccines. Absolute fact. Nice, Bianca. Nice. The fact that the efficiency of vaccine is being questioned is incredibly ignorant. They're highly efficacious. Yeah, I agree. Fungi. Yeah, their efficacy is insanely good. I don't need to check out anyone's Twitter account, Squeebs. I can just like, I'm a scientist, so I can read like published literature. Bad Vares. Let's check it out though. Let's see. Bad Vares. I can roast this guy though. I can make fun of him. Instead of rational government that makes informed decisions, we just get it demagogues. I know, Marissa. I'd really like technocracy. I like the idea of like informed people making more, decisions. My daughter got a fever and from the shot. Yeah, Peach Lane. That's usually what happens. You get a fever because that's the immune response in response to the vaccine. That's good. That's a good thing. Well, people just look up the actual diseases before they start hating on the vaccines. I know, Green Bunny. Exactly. Why do keyboard warriors think that they're scientists because they read one Google search? I don't know, Jessica. That's a good question. I highly encourage anyone in this live to heavily do their own research on vaccines. Crystallian, no, that doesn't make any sense. You're not a scientist. You don't know what you're talking about. It's like, I definitely agree with everyone should just do their own research on brain surgery before you have brain surgery. Like, it wouldn't make any sense. It's not ignorant. I've seen more people get sick with the COVID vaccine. Yeah, that's because Daisy. That's because you're having a reaction to a small amount of the virus, and if you actually had a real virus infection, you're going to have even more of an immune response. Hey, Gaynor's back. Hey. Oh, Gaynor, don't even respond to Gaynor. It's okay. Not vax, had COVID, was like ill for 3 days, was like a cold. Yeah, Debs, 1.2 million people died in the United States because of COVID, so it's a huge thing. Go look at the millions of documented videos of parents who all of them had normal babies. Yeah, Crystallian, that's all false. That's all fake. It doesn't. There's no. It's all disinformation. Then after vaccines, they were injured for the rest of their lives. Yeah, that's just wrong, Crystallian. Doesn't make any sense. It's all fake. Wish I was joking telling you that. Yeah. It's a good question. Yeah, do your own research. What's the p-value? That's a great question, Marissa. Great point. Vaccines infect the body. You're right, Gaynor, and it gives you antibodies. You're right. Okay, yeah, we can go to Bad Vares. Bad Vares takes. All doctors, pediatricians get paid thousands to boost vaccines. Yeah, that's not true, Crystallian. That's not true at all. UNICEF has millions in other countries, but death rates are high despite high vaccine rates. Yeah, Peach Lane, like vaccines save the lives of 5 million people a year. There's just nonsense. 3 girls I know miscarried. Yeah, Debs, maybe they have a lot of other factors. It's not vaccines. Okay. How do you know they are publishing correct info? Because it's corroborated from multiple sources and it's public knowledge. No, they didn't. Oh, come on. No, they didn't. Look at the actual studies, not the media. So, Tina, you're on science side. Never mind. I'm sorry. That's right. Why aren't the scientists stopping Florida's governor? It's hard, because they actually have they don't have that much. Oh, Bad Veers on X. Here we go. Do. I don't know. I'm unemployed. I don't know. I got so sick from my COVID vaccines. Yeah, sure, girl, because that you're actually reacting to the virus, and you'd get more sick if you had a SARS-CoV-2 infection. That's what they always say. They save lives. Yeah, they also kill thousands of people. Nope, that's not true, Crystallian. That's not true at all. Yep. Hi, Kimchi. How's it going? Please look up the NIH study on vaccine with thyroid dysfunction. Yeah, there's whatever dysfunction you'd have it worse with the virus or the pathogen, Daisy. So again, it's just nonsense. Oh, no problem, Life Source. We're trying out here. You are uneducated. I'm flagged for misinformation. Nice. Nice. Thanks, guys. Yeah. Yeah, right. Yeah, that's not true. I know, Marissa. I was thinking about that too. I think that like I have to night. I can't do that. Yeah. 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 We are. I'm on the vaccine side. I'm on the Republican side, guys. We're all Republicans here. Nope, Gaynor, that's completely false. All right, guys. Well, I think that's it. No, you're just Crystalline, you're just wrong. Hey, I'm just gonna go to bed, bro. Thank you though, man. Yeah, you're Gaynor, you're wrong. Yeah, I agree, Marissa. All right. Peace, guys. Thanks for coming on. I appreciate it. It's okay, V. It's okay. People get all spicy when they get wrong. They're wrong. Bad Bears. I'm on there and they don't have any posts. Bad Bears hasn't posted yet. No, Daisy. Okay. Thanks, Steven. Thank you. Thanks, Jessica. Thank you. I appreciate you guys. We're out, guys. That's it. Thank you. Thank you. Boom, boom, boom. Well, I can't I start the thing? Oh my gosh. I can't start the, oh my gosh. All right, guys. See ya. Peace. Okay. Good night. Bye, Bianca. Bye. Peace. Peace.